The blood hit the floor before the screaming started. Trauma Bay 3 Fury at Mercy Point Hospital erupted into chaos. Monitors flatlined, a teenager's chest cracked open on the table, and 6 doctors stood frozen like they'd forgotten every year of medical school. The attending's hand shook. The resident backed into a crash cart. Someone dropped a scalpel. And limping through the doorway, slow, uneven, practically dragging her left leg, came the nurse they'd spent 6 months calling useless. Rachel Dawson didn't run, didn't shout, just moved forward with the kind of certainty that made the room go quiet even as the patient died. 30 seconds later, that kid's heart restarted. 2 hours after that, military convoys would roll through downtown Portland, armed soldiers would seal every hospital entrance, and a colonel would demand one person by a call sign the staff had never heard. The woman they'd been trying to fire was about to become the only thing standing between survival and catastrophe. If you're watching this, stay until the very end, because what happens next will rewrite everything you thought you knew about power, respect, and the people we overlook. Like this video, drop a comment with your city so I can see how far this story travels. And let's get into it. Rachel Dawson's shift started the way it always did, with someone reminding her she didn't belong. "You're limping again." Charge nurse Victoria Hale didn't even look up from her tablet. Just said it flat, clinical, like diagnosing a wound that wouldn't heal. The kind of observation that pretended to be concerned but landed like an insult. Rachel adjusted her grip on the supply cart. "I'm fine." "You're slow." Victoria finally glanced over, her expression somewhere between pity and irritation. "Dr. Brennan complained again, said you can't keep up during traumas." "I kept up fine." "He said you're a liability." The words hung there in the fluorescent glare of Mercy Point's emergency department, sterile and sharp. Around them, the morning shift cycled through its routine, nurses restocking med rooms, residents gulping coffee, the low hum of monitors tracking heartbeats that hadn't flatlined yet. Normal. Controlled. The kind of environment where hesitation got you killed and weakness got you reassigned. Rachel had been getting reassigned for 6 months. "I'll talk to him," she said quietly. Victoria's mouth tightened. "Don't bother. Admin already made the call. You're off trauma rotation effective today. Intake desk only." Something cold settled in Rachel's chest, but her face didn't move. She'd learned that in places where showing pain made you a target. "Understood. It's not personal, Dawson. You're just—" Victoria gestured vaguely at Rachel's left leg, the one that didn't quite straighten, the one that made her gait uneven and her balance a calculated risk. "You're not built for this kind of work anymore. Maybe outpatient care, something less intense." Rachel nodded, pushed the cart toward the supply room. Didn't argue. She never did. Behind her, she heard Victoria mutter to another nurse, "Poor thing, probably some car accident. She tries, but—" Rachel kept walking. The limp wasn't from a car accident. It was from a convoy ambush outside Kandahar, where an IED turned a transport truck into shrapnel and fire, and she'd dragged 3 soldiers out of the wreckage with a shattered femur and a bleeding gut. But Mercy Point didn't know that. Mercy Point knew her as the quiet nurse who moved too slow, spoke too soft, and took every demotion without complaint. That was the point. She'd come here to disappear. By noon, Rachel was stationed at the intake desk, a low-traffic purgatory where the hospital sent nurses they didn't trust with actual emergencies, a sprained ankle, a kid with a fever, an elderly man convinced his heartburn was a cardiac event. She processed them all with the same calm efficiency, took vitals, logged symptoms, and sent them down the hall to doctors who'd never remember her name. Through the glass partition, she could see Trauma Bay 3. Dr. Marcus Brennan was in there now, strutting around a gunshot wound case like he was performing surgery for an audience. Tall, sharp-featured, the kind of attending who wore his ego like a second white coat. He'd been the loudest voice pushing for her removal, had written 3 separate complaints about her inability to perform under pressure. Rachel watched him botch an intubation, watched the resident have to step in and fix it. She said nothing. "Ms. Dawson." She turned. A woman in her 50s stood at the desk, pale and sweating, one hand pressed to her chest. I can't breathe right." Rachel's eyes sharpened, skin clammy, jugular vein distended, respiratory rate elevated but shallow. She stood, came around the desk. "How long?" Maybe 20 minutes? I thought it was anxiety, but Rachel's hand went to the woman's wrist, pulse thready, irregular. Sit down. Don't move. She hit the call button, grabbed a wheelchair, got the woman seated and rolled her toward the triage nurse, rattling off vitals and observations in a clipped, precise cadence that made the triage nurse blink. Possible pulmonary embolism, Rachel said. She needs imaging now. The triage nurse hesitated. Did Dr. Brennan clear? She doesn't have time for clearance. Move. Something in Rachel's voice made the nurse obey. The woman disappeared into a bay, and 10 minutes later, radiology confirmed a massive clot in her lung. Another 5 minutes, and she would have stroked out in the waiting room. Nobody thanked Rachel. Nobody even mentioned it. By the time her shift ended, the save had been credited to the triage nurse's sharp eye, and Rachel was back at the intake desk, invisible again. The breaking point came 3 days later. Rachel was restocking gauze in a supply closet when she heard Dr. Brennan's voice echo down the hallway, loud and theatrical. I'm serious. The woman's a joke. Limps around like she got hit by a truck, can't keep pace, and she's got this look like she's somewhere else, traumatized or something, probably PTSD. Laughter. Other doctors, entertained. Rachel's hand stilled on a box of gloves. Admin should have cut her months ago, Brennan continued. But you know how it is. Discrimination lawsuits. Easier to shuffle her somewhere she can't do damage. She saved that PE case last week, someone else said. A resident, younger, uncertain. Brennan scoffed. Luck. Even a broken clock's right twice a day. Rachel closed the cabinet, walked out of the supply room. Brennan was standing near the nurse's station, surrounded by 3 other doctors, grinning like he'd just delivered a punchline. He didn't notice her until she was 5 feet away. His grin faltered. Dawson, didn't see you there. I know, Rachel said. Her voice was even, calm, the kind of calm that made people nervous without knowing why. Brennan's smirk returned, defensive now. Look, it's nothing personal. You're just not built for this, Rachel finished. You've said it before. Well, he shrugged. It's true. Rachel held his gaze for 3 seconds, long enough for the hallway to go quiet, long enough for the other doctors to shift uncomfortably. Then she nodded. Understood. She turned and walked away. Brennan muttered something behind her. More laughter. Rachel kept walking. That night, she sat in her apartment, a bare 1-bedroom in northeast Portland with nothing on the walls and a single chair by the window, the kind of place someone lived when they weren't planning to stay. On the table beside her sat a phone she hadn't turned on in 8 months. Her hands hovered over it. Then she pulled back. Not yet. She'd left that life for a reason. Left the call sign, the missions, the weight of keeping people alive when the world was actively trying to kill them. She'd traded combat medicine for civilian nursing because she thought it would be easier, quieter, a place where the stakes weren't life and death every single second. But Mercy Point had its own kind of combat, and she was losing. But the next morning, Victoria called her into the office before her shift started. Rachel knew what was coming before she sat down. This isn't working, Victoria said, and at least she had the decency to look uncomfortable. You're a good nurse, Dawson, but you're not a good fit for emergency medicine. Dr. Brennan's filed another complaint, and frankly, admin agrees. Rachel's expression didn't change. What are you saying? We're recommending a transfer, outpatient clinic. Regular hours, no trauma, no... You're firing me. Victoria winced. We're reassigning you to a position that doesn't exist yet. We're working on... You're firing me, Rachel said again, flat and certain. Victoria folded her hands on the desk. You'll have 2 weeks to transition. I'm sorry. Rachel stood. No, you're not. She walked out. Behind her, Victoria called, Dawson, wait! Rachel didn't stop. She made it halfway to the staff locker room before the alarm started screaming. Code Blue. Trauma Bay 3. Rachel's body reacted before her brain caught up, muscle memory from 1,000 crises, instincts honed in places where hesitation meant death. She turned toward the sound, saw nurses sprinting, heard the chaos building like a wave about to break. She should have kept walking. She was off trauma, officially sidelined, not her problem anymore. But her feet carried her forward anyway. Trauma Bay 3 was a disaster. A teenager, maybe 16, 17, lay on the table, his chest a mangled mess of torn tissue and shattered ribs. Motorcycle accident, from the looks of it. His breathing was shallow, ragged, and his skin had gone the color of old paper. Dr. Brennan stood at the head of the bed, barking orders that nobody was following because nobody knew what the hell they were doing. Get me a chest tube. No, wait, suction first. Someone check his pressure. The kid's monitor flatlined. Brennan froze. The resident froze. 2 nurses froze. Rachel stepped into the room. Start compressions, she said. Nobody moved. Now. Her voice cut through the panic like a blade. You, compressions. You, bag him. You, draw up epi, 1 milligram, and get a crash cart over here. The nurses obeyed before they realized they were obeying. Rachel moved to the table, her hands already assessing. Airway compromised, tension pneumothorax on the right side, possible hemothorax. She grabbed a scalpel from the tray. Brennan finally found his voice. Dawson, what the hell do you think you're... She cut between the kid's ribs without hesitation, found the pleural space, inserted her fingers, and felt the rush of trapped air release. The kid's chest expanded, his monitor beeped. Faint, but there. Get me a 14-gauge needle and a flutter valve, Rachel said. He's got a pneumo. We decompress now or he's dead in 2 minutes. The resident handed her the needle. Rachel didn't look up, just inserted it into the second intercostal space, felt the hiss of escaping air, and watched the kid's oxygen saturation climb. His heart rhythm steadied. The room exhaled. Rachel stepped back, blood on her gloves, her gaze already scanning for the next crisis. He needs a chest tube and a CT, possible liver laceration. Move him upstairs now. The nurses moved. The resident moved. Brennan just stared at her. Where, he said slowly, did you learn to do that? Rachel pulled off her gloves, met his eyes. Nowhere you'd understand. She walked out of the bay. Behind her, the trauma team stabilized the kid, prepped him for surgery, saved his life. Rachel went back to the intake desk. Mom, an hour later, a man walked into the ER. 30s. Buzz cut. Tan jacket zipped to his throat despite the spring heat. He moved with the kind of precision that came from military training. Weight balanced, eyes scanning, every step deliberate. He stopped at the intake desk. Rachel looked up. The man's gaze locked on her face. His eyes widened. Then he stepped closer, leaned in, and his voice dropped to a whisper. You're one of them. Rachel's blood went cold. Excuse me? She said carefully. The medics. His hand trembled as he gripped the edge of the desk. The ones who pulled us out. You've got the look. The way you move. I've seen it before. Rachel's face was stone. Sir, if you need medical attention. I was in Helmand, he said, and his voice cracked. Second tour. Our convoy got hit, and this medic, she was... He stopped. Swallowed hard. She saved 6 of us. Kept us alive for 40 minutes under fire until the evac came. I never got her name, but I remember her eyes. He stared at Rachel like he was seeing a ghost. You've got the same eyes. The hallway had gone quiet. Other staff were watching now, confused, curious. Rachel's jaw tightened. I think you're mistaken. No. His voice was stronger now, certain. I'm not. He straightened, looked around at the nurses, the doctors, the whole sterile theater of Mercy Point's emergency department. Then he looked back at Rachel. They don't know who you are, do they? Rachel didn't answer. The man nodded slowly, respectfully, like he was acknowledging something sacred. Then he turned and walked out. The staff stared after him, then at Rachel. Victoria was the first to speak. What was that about? Rachel's hands were steady as she picked up a clipboard. No idea. But her pulse was hammering. Her breath was shallow. Because she'd spent 8 months building a new life. A quiet life. A life where nobody knew her name or her call sign or the things she'd done in places the news didn't cover. And in under 2 minutes, a stranger had cracked it wide open. She made it through the rest of her shift on autopilot. Processed patients, took vitals, avoided eye contact. At 6 p.m., she clocked out. At 6:15, she was walking to her car in the staff lot when she heard the sound. Low, rhythmic, distant, but growing closer. Helicopter rotors. Rachel stopped, looked up. 4 black helicopters materialized over the skyline, flying low and fast, their shapes sharp against the evening sky. Military. Unmarked. Moving with the kind of purpose that made her stomach drop. They were headed straight for the hospital. She ran. By the time she made it back inside, the ER was in chaos. Security guards were shouting. Administrators were on their phones. And through the glass doors, Rachel could see them, soldiers in tactical gear, armed and moving in formation, surrounding the building like they were securing a combat zone. A colonel stepped through the entrance. Tall, graying, medals on his chest. He scanned the room with the cold efficiency of a man who'd given 1,000 orders and expected them obeyed. "I need to speak to Shield 6, he said. His voice carried. "Now." The staff looked at each other, bewildered. "There's no one here by that name," Victoria said, stepping forward. "Sir, I don't know what—" "Not a name. A call sign." The colonel's gaze swept the room. "She's here. I know she is." Rachel stood near the back of the crowd, half hidden behind a cluster of residents. The colonel's eyes found her. Everything stopped. He crossed the room in 4 strides, stopped 3 feet away. Then he saluted. Every soldier in the room snapped to attention and did the same. The ER went dead silent. Victoria's mouth fell open. Brennan looked like he'd been struck. The residents stared. The colonel lowered his hand. "Ma'am, we have a situation." Rachel's voice was barely a whisper. "I'm not active anymore." "I know." His expression was grim. "But we've got a convoy inbound. 8 casualties, 3 critical. Civilian hospitals can't handle it, and the base is 40 minutes out. You're the closest thing we've got to a miracle right now." Rachel shook her head. "I can't. You're the only one who can." Behind him, Brennan finally found his voice. Wait. What the hell is going on? Who is she?" The colonel didn't even look at him. "She's the medic who kept 32 soldiers alive in a firefight outside Kandahar when every other medical officer was dead or dying. She's the reason men walked out of ambushes nobody survives. She's a legend, and if you've been treating her like anything less, you're a fool." The words hit like artillery fire. Brennan's face went white. Victoria looked like she might faint. Rachel stood there, frozen. Her carefully constructed invisibility shattered in under a minute. The colonel's radio crackled. "Convoy ETA 4 minutes." He looked at Rachel. "Ma'am, please." Rachel's hands were shaking. Her leg throbbed. Her mind was screaming at her to run, to hide, to go back to being nobody. But somewhere in the distance, she could hear the sirens. 8 casualties. 3 critical. Men who needed someone who refused to let them die. She took a breath. Then she nodded. "Get them to Trauma Bay 1, she said. Her voice was steady now, cold, the voice of someone who'd given orders under fire. "Clear it. I need 2 units of O-neg on standby, a full surgical kit, and anyone with combat medicine training. If you don't have it, stay out of my way." The colonel smiled. "Yes, ma'am." He turned to his soldiers. "You heard her. Move." They moved. Rachel walked toward Trauma Bay 1, her limp barely noticeable now, adrenaline overriding pain. Behind her, the staff of Mercy Point Hospital stared in stunned silence. The woman they'd tried to erase had just become the only thing standing between life and death. And the convoy was 30 seconds out. The convoy arrived like thunder. 3 armored trucks screamed into the ambulance bay, their tires smoking against asphalt, doors already flying open before they'd fully stopped. Soldiers spilled out, some running, some limping, 2 being carried on makeshift stretchers cobbled together from tactical vests and rifle straps. The air filled with shouting, with the metallic smell of blood and gunpowder, with something Rachel hadn't breathed in 8 months, the sharp electric panic of combat medicine. She was already moving. Trauma Bay 1 had been cleared in under 90 seconds. The colonel's people worked with military efficiency, supply carts restocked, monitors calibrated, IV poles assembled in neat rows like soldiers at attention. A nurse Rachel didn't recognize stood near the door, young and terrified, clutching a clipboard like it might protect her. Rachel walked past without looking at her. "If you're staying, grab gloves and stay quiet. If you're going to panic, leave now." The nurse stayed. The first soldier came through on a gurney, his uniform soaked black with blood. his face the color of cement. Shrapnel wound to the abdomen, from the looks of it, jagged metal still embedded in his gut, intestines visible through torn muscle. He was conscious. Barely. His eyes tracked Rachel as she stepped to his side. "Hey," she said, her voice low and steady. "What's your name?" "Corporal." "Hayes." His breath hitched. "Ma'am, I can't feel my legs."
"I know." Rachel's hands were already working, cutting away his vest, exposing the wound, assessing damage with the kind of speed that came from doing this in the dark under mortar fire. "We're going to fix that, but I need you to stay with me. Can you do that?" Hayes nodded, his jaw tight. "Good. Don't close your eyes." She looked up. The resident who'd helped during the motorcycle case stood frozen near the supply cart, staring at the blood like he'd never seen it before.
"You," Rachel said sharply. "Name?"
Dr. Patel.
"Patel. 2 large-bore IVs, run them wide open. Then get me 4 units of ONEG and call the OR. Tell them we've got a probable bowel perforation and we're coming up hot." Patel moved. Rachel turned to the nurse. "Vitals. Every 60 seconds, call out anything that drops." The nurse's hand shook as she attached the blood pressure cuff, but she did it. The second gurney crashed through the door. This one was worse. A sergeant with half his face burned, his right arm mangled, bone showing through charred skin. He wasn't screaming. That was the problem. Burn victims who went quiet were either in shock or shutting down. Rachel pointed to an empty bay. "Over there. Someone get me saline and start flushing those burns. Keep him warm. Blankets, heat lamps, I don't care. His core temp's dropping." A second resident appeared, older, steadier. "I've got him." "No." Rachel's voice cut like a scalpel. "You've got airway management. His throat's swelling. If he can't breathe in 5 minutes, none of this matters. Intubate him now." The resident hesitated for half a second, just long enough for Rachel to see the doubt, then nodded and moved. The third critical case came in on foot. A lieutenant, mid-30s, walking under his own power but holding his side like his ribs were about to fall out. Rachel knew that walk, knew what it meant when someone stayed upright through sheer willpower and nothing else. "Sit," she said, pointing to a gurney. He shook his head. "Others are worse. Sit, now." He sat. Rachel pulled his hand away from his side. Blood welled up immediately, dark, steady, arterial. She pressed a gauze pack against it, held firm. "How long ago?" 40 minutes, maybe more." "You've been holding pressure this whole time?" "Had to." His voice was strained but even. "Couldn't let the bleeding slow the convoy." Rachel's jaw tightened. 40 minutes of self-applied pressure while riding in a truck through downtown traffic. Most people would have passed out. This man had stayed conscious through pure stubbornness. "You're an idiot," she said quietly. He almost smiled. "Yes, ma'am," she called over her shoulder. "I need an ultrasound and a surgical consult, possible splenic rupture." Then, lower, just to him. "You did good, but let me take it from here." He nodded, his eyes closed. Rachel's hands moved faster. Behind her, Trauma Bay 1 had transformed into controlled chaos. Monitors beeped in overlapping rhythms. Nurses moved between gurneys like dancers in a choreographed nightmare. Patel was running the IVs on Hayes, his earlier panic replaced by grim focus. The other resident had intubated the sergeant and was now manually bagging him, sweat dripping down his face. And in the doorway, half the hospital staff had gathered to watch. Brennan stood at the front, his expression somewhere between shock and something that looked like fear. Victoria was beside him, pale and silent. Behind them, residents and nurses crowded together, whispering, staring at the woman who'd gone from useless to indispensable in the span of 10 minutes. Rachel ignored them all. Hayes started crashing. His monitor shrieked, blood pressure dropping, heart rate climbing into the danger zone. "He's bleeding out," Patel said, his voice tight. Rachel was already there. She pressed her hands into Hayes's abdomen, felt the hot rush of blood that meant something major had torn loose. "Get me into his belly. I need a scalpel, clamps, and suction. Now." "We can't do surgery here. We don't have time to move him." Rachel's eyes didn't leave Hayes's face. "He'll be dead before he hits the elevator. We do it here or we don't do it at all." Patel stared at her. Then he grabbed the scalpel. Rachel cut. The incision was fast, brutal, efficient. She opened Hayes's abdomen in 3 strokes, her hands moving through layers of tissue like she'd done this 1,000 times before. Because she had. In field hospitals with no power. In the back of helicopters. In blown-out buildings while gunfire rattled the walls. Blood poured out. Rachel ignored it, reached in, found the bleeder, a torn mesenteric artery, shredded by shrapnel. "Clamp," she said. Patel handed it to her. She clamped the artery. The bleeding slowed. Hayes's pressure stabilized. The room exhaled. Rachel didn't. She was already packing the wound, preparing him for transfer. "Get him upstairs. Tell surgery he's got a temporary repair, but he needs a full X-lap. Move." They moved. Hayes disappeared through the door, still alive, still breathing. Rachel turned to the next patient. The burn sergeant was stable, intubated, sedated, his vitals holding. The lieutenant with the splenic injury was being prepped for imaging. The remaining 5 soldiers had minor injuries, lacerations, fractures, concussions. Serious, but manageable. Rachel moved through them like a shadow, assessing, prioritizing, directing care with the kind of precision that left no room for doubt. She didn't raise her voice, didn't need to. Every word landed like an order, and every order was obeyed. Somewhere in the middle of it, the colonel appeared at her side. "Ma'am," he said quietly, "we've got the rest stabilized. Medevac's inbound to take them to the base hospital." Rachel nodded, her hands still working on a soldier's dislocated shoulder. "Good. You saved them." His voice was low, almost reverent. "All of them." "Not yet." Rachel relocated the shoulder with a sharp pop, ignored the soldier's grunt of pain. "They're not out of the OR." The colonel watched her for a moment. Then he said, "I heard what happened here, how they treated you." Rachel's hands stilled, just for a second. "It doesn't matter." "It does." His voice hardened. "These people had a combat medic with 2 silver stars and a Navy Cross, and they stuck her at a desk because she limped." Rachel didn't look at him. "I'm not that person anymore." "Yes, you are." The colonel's gaze didn't waver. "You just tried not to be." Before Rachel could respond, a voice cut through the room. "Excuse me." Dr. Brennan stood near the doorway, his face flushed, his hands clenched at his sides. The entire trauma bay went quiet. "I need to speak with Nurse Dawson," he said, too loud, too sharp. "Privately." Rachel finished bandaging the soldier's arm. Didn't turn around. "I'm busy." "This can't wait." "It'll have to." Brennan's voice rose. "You just performed an unauthorized surgery in my ER. You opened a patient without attending supervision, without proper consent, without—" Rachel turned. Her eyes were flat and cold. "Without him dying." "That's what I did without." Brennan's mouth opened, closed. "You don't have the authority. I had the skill. That's what mattered. You're a nurse. I'm a combat medic with 8 years of field experience and more trauma saves than you'll see in your entire career." Rachel's voice was quiet, but it carried. "And if you'd rather that kid bled out on your table so you could follow protocol, then you're in the wrong line of work." The room was dead silent. Brennan's face went from red to purple. "You're suspended, effective immediately. I'm reporting this to the board, to the state licensing agency, to do it." Rachel pulled off her gloves, tossed them in the trash. "I was already being fired anyway." She walked past him without another word. The colonel followed her into the hallway, his expression grim. "Ma'am, don't." Rachel kept walking. "I'm done. I came here to disappear, and I just made that impossible, so I'm leaving before this gets worse." "It's already worse." Rachel stopped, turned. "What does that mean?" The colonel's jaw tightened. "The convoy wasn't random. We were transporting a high-value asset when we got hit. Coordinated ambush, 3 vehicles, professional execution. Someone knew our route." Rachel's blood went cold. "Where's the asset?" "Still secured, but—" The colonel hesitated. "He asked for you by name." "That's impossible. I've been dark for 8 months. Nobody knows." "He knows." The colonel pulled out a tablet, turned it toward her. "Take a look." The screen showed a photograph. A man in his 50s, graying hair, sharp eyes. Rachel recognized him instantly. Her hand started shaking. "No," she whispered. "He was your commanding officer in Kandahar," the colonel said. "Colonel James Briggs. Retired now, but he's been doing contract work overseas. He was on that convoy because he specifically requested extraction through this hospital." Rachel's mind was racing. Briggs, the man who'd led her unit through 3 tours, the man who'd recommended her for commendation she'd never wanted, the man who'd been in the transport when— "He's dying," the colonel said quietly. "Stage 4 cancer, 6 months, maybe less, but he insisted on coming here, said there was something he needed to tell you." Rachel's throat tightened. "I can't. He's in Bay 4, stable for now, but he won't talk to anyone else." Rachel looked at the tablet, at Briggs's face, at the past she'd spent 8 months trying to bury. Then she walked toward Bay 4. The hallway felt longer than it should have. Every step echoed. Every breath was too loud. By the time she reached the door, her hands were numb. Briggs was sitting upright on the gurney, an IV in his arm, his face lined with pain and exhaustion. But when he saw Rachel, he smiled. "Shield 6, he said, his voice rough. "Been a long time." Rachel stood in the doorway, couldn't move. "Sir." "Don't call me that, I'm retired." He gestured to the chair beside the bed. "Sit. We need to talk." Rachel didn't sit. "Why are you here?" "Because I'm dying, and I owe you the truth." "I don't want it." "I know." Briggs's smile faded. "But you're getting it anyway." Rachel's jaw tightened. She stepped inside, let the door close behind her. Briggs studied her for a long moment. "You blame yourself for Kandahar, for what happened to the unit." It wasn't a question. Rachel didn't answer. "You think you failed us," Briggs continued, "that if you'd been faster, better, smarter, more of us would have walked out." 14 men died, Rachel said, her voice barely audible. "I was supposed to keep them alive. You kept 32 alive in a firefight that should have killed everyone. It wasn't enough." Briggs leaned forward, his eyes hard. "Listen to me. What happened in Kandahar wasn't your fault. It was mine." Rachel's breath caught. "I made the call to take that route," Briggs said. "I ignored the intel reports. I pushed the convoy through because I thought we could handle it. And when the ambush hit, you didn't fail. You saved everyone who could be saved, but I let you carry the guilt because I was too much of a coward to admit I'd gotten my own men killed." The words hit like bullets. Rachel's legs gave out. She sank into the chair. "I ruined your career," Briggs said, his voice breaking. "I wrote reports that made it sound like the medical response was delayed. I let the brass think you'd hesitated, and I did it because I couldn't face what I'd done." Rachel stared at him. "Why are you telling me this now?" "Because I'm dying, and I don't want to take this to hell with me." Briggs's hands were shaking. "You deserved better. You deserved the truth, and I'm sorry." Rachel couldn't speak, couldn't breathe. 8 months of guilt, 8 months of thinking she'd failed, 8 months of hiding from a failure that had never been hers. "You were the best medic I ever served with," Briggs said quietly, "and I destroyed you because I was too weak to own my mistakes." Rachel's vision blurred. She stood, turned toward the door. "I need to go." "Rachel, don't." Her voice cracked. "Just don't." She walked out. The hallway was spinning, the lights too bright. She made it to the staff bathroom, locked the door, and leaned against the sink. Then she broke. 8 months of control shattered in under a minute. She gripped the edge of the sink, her shoulders shaking, her breath coming in ragged gasps. The guilt that had defined her, the failure that had driven her into hiding, it had all been a lie. She'd saved 32 men, she'd done everything right, and it still hadn't been enough. A knock on the door. "Dawson? You in there?" Victoria's voice, concerned, tentative. Rachel wiped her face, steadied her breathing. "I'm fine." "You're not." A pause. "Can I come in?" Rachel unlocked the door. Victoria stepped inside, and for the first time since Rachel had started at Mercy Point, she looked uncertain, almost human. "I heard what happened," Victoria said. "With the colonel. With everything." Rachel leaned against the sink, didn't look at her. "You here to fire me officially?" "No." Victoria's voice was quiet. "I'm here to apologize." Rachel's head turned. "I've been a charge nurse for 12 years, Victoria said, and I've seen a lot of nurses come through. Some are good, some are great, and some—" She paused. Some are so far beyond the rest of us that we don't even recognize what we're looking at. Rachel said nothing. You saved 8 soldiers today, Victoria continued. You performed field surgery in an ER bay with no backup and no margin for error. You did things I've only seen in war movies, and I spent 6 months treating you like you were broken. I am broken, Rachel said. No. Victoria's voice was firm. You're a combat veteran with a limp. That's not the same thing. Rachel's throat tightened. I don't know what happened to you overseas, Victoria said, and I'm not going to ask. But I know what I saw today, and I know I was wrong. She held out her hand. Rachel stared at it, then slowly she shook it. You're not fired, Victoria said, and if Brennan tries to push it, he'll have to go through me. Rachel nodded, started to say something, then stopped. Because through the bathroom door, muffled but unmistakable, came the sound of shouting. Not medical shouting, not the controlled chaos of an ER. Something else. Victoria's radio crackled. Security to the main entrance. We've got a situation. The transmission cut off. Then came the gunfire. 3 shots. Sharp. Loud. Close. Victoria's face went white. Oh my God! More shots. Screaming now. The sound of glass shattering. Rachel moved without thinking. Grabbed Victoria's arm, shoved her toward the supply closet. Get in. Lock the door. Don't come out until security clears it. What are you? Go. Now! Victoria ran. Rachel stepped into the hallway. The gunfire was louder now, coming from the direction of the main entrance. She could hear people running, shouting, the distinctive crack of something semi-automatic echoing off tile and concrete. She should have run, should have hidden. Instead, she moved toward the sound. Because somewhere in that lobby, people were dying. And every instinct she'd ever honed told her she was the only one who could stop it. The hallway was empty. Most of the staff had either locked themselves in patient rooms or fled toward the back exits. Smart, safe, exactly what they were supposed to do. Rachel kept walking. She passed the nurses' station, abandoned, computers still running, half-finished charts scattered across desks. Past a janitor's closet where she could hear someone crying softly. Past a wheelchair left sideways in the middle of the corridor, like whoever had been pushing it had just let go and run. The main lobby was 30 feet ahead. Rachel stopped at the corner, listened. The shooting had paused. In its place, heavy breathing. Footsteps. A voice, male, shouting something she couldn't make out. She risked a look around the corner. The lobby looked like a war zone. The front windows were blown out, glass everywhere. 4 people were on the floor, 2 moving, 2 not. Blood pooled under the security desk. And standing in the center of it all, holding a rifle like he'd been born with it, was a man in his 20s. Buzzed hair, wild eyes, tactical vest over a black hoodie. He was screaming at someone Rachel couldn't see. Where is he? Where's the colonel? Rachel's stomach dropped. This wasn't random. This was targeted. The man fired another shot into the ceiling. Plaster rained down. I know he's here. I know you brought him in. Tell me where or I start dropping bodies. A woman's voice, shaking, terrified. Please, we don't know. Liar. He aimed the rifle at her. Rachel stepped into the lobby. Hey. The man spun. The rifle came around with him. Rachel raised her hands, kept her voice level. You're looking for Colonel Briggs. The man's eyes narrowed. Who the hell are you? The person who knows where he is. Bullshit. Bay 4, 2nd floor. He's got a guard posted outside, but the room's not locked. Rachel took a step forward. You want him. He's there. But you need to let these people go first. The man laughed. It sounded unhinged. You think I'm stupid? You think I'm just gonna... I think you're here because Briggs got your unit killed, Rachel said quietly. And you want him to pay for it. The man froze. Rachel kept talking. I think you were one of his soldiers. I think something went wrong on a mission and you blame him. And maybe you're right. Maybe he made the call that got your friends killed, but shooting civilians won't bring them back. The man's hands were shaking on the rifle. You don't know anything. I know what guilt looks like. Rachel's voice was steady. I know what it does to you. How it eats at you until there's nothing left but rage and the need to make someone pay. Tears were streaming down the man's face now. He left us. We were pinned down and he ordered the retreat and we... His voice broke. They died screaming and he just left. Rachel took another step. I'm sorry. Don't. The rifle came up again. Don't pretend you care. I'm not pretending. Rachel was close enough now that she could see the man's finger on the trigger, could see the safety was off, could see he was maybe 2 seconds from either shooting her or shooting himself. I was a medic. I know what it's like to lose people you can't save, and I know Briggs. If he left you, he had a reason. Maybe not a good one, but a reason. The man was sobbing now. I just want him to say it. I want him to admit what he did. Then go talk to him. Rachel lowered her hands slowly. Put the gun down. Let these people go, and I'll take you to him myself. For a moment, nothing moved. The entire lobby held its breath. Then the man's shoulders sagged. The rifle dropped. Rachel moved fast, grabbed the weapon, ejected the magazine, cleared the chamber. The man sank to his knees, still crying. Security flooded in 10 seconds later, armed, shouting, swarming the shooter. They zip-tied his wrist, hauled him up, started reading him his rights. Rachel handed the rifle to one of them. Then she turned to the people on the floor. 2 were already gone. Nothing she could do. The other 2 were bleeding out. She dropped to her knees beside the first, a security guard, maybe 50, gut shot. His hands were pressed to the wound, but blood was seeping through his fingers. Hey, Rachel said. Look at me. He did. I'm a nurse. I'm going to help you, but I need you to stay calm. Can you do that? He nodded. Rachel ripped open his shirt, assessed the entry wound. Through and through, just left of center mass. Missed the major vessels, but definitely perforated something internal. He needed surgery, fast. She pressed her hands over his, applied pressure. Someone get me a gurney and call the OR. This one goes up now. Nurses appeared from nowhere, the same ones who'd hidden, who'd run, who were now stumbling back into the chaos because the shooting had stopped and people needed help. Rachel coordinated them like she was back in Kandahar. Triage, stabilize, transport. The 2 survivors were moved within minutes. By the time she stood up, her hands were covered in blood and the lobby had filled with police, paramedics, hospital administrators. And Dr. Brennan. He walked toward her slowly, his expression unreadable. Rachel waited. You just talked down an active shooter, Brennan said. I just did my job. Your job is nursing. My job, Rachel said quietly, is keeping people alive, however I have to. Brennan stared at her for a long moment. Then he said, I was wrong about you. Rachel didn't answer. I thought you were weak, Brennan continued. I thought the limp meant you couldn't handle the pressure, but you just walked into gunfire to save people I wouldn't have had the guts to even look at. Rachel's jaw tightened. Is there a point to this? The point is I'm an asshole. Brennan's voice was flat. And I'm sorry. Rachel looked at him. Really looked. Saw the shame in his face, the genuine regret. It didn't erase 6 months of humiliation. Didn't undo the damage. But it was something. Apology noted, she said. Then she walked past him toward the stairs. She needed to check on Briggs. Bay 4 was surrounded by MPs now, 2 standing guard, another 3 patrolling the hallway. They recognized Rachel immediately, stepped aside without question. Briggs was still sitting up. He looked worse than before, paler, more drawn, but his eyes were alert. Heard there was some excitement downstairs, he said. Rachel closed the door. One of your soldiers tried to kill you. Briggs's expression didn't change. Which one? Didn't get his name, but he said you left his unit to die. Briggs closed his eyes. Syria, 8 months ago. We were extracting a target and got ambushed. I made the call to pull out before we secured the perimeter. Lost 3 men. Why? Because staying would have lost all of them. Briggs opened his eyes. But that doesn't make it easier, doesn't make it right. Rachel sat down in the chair beside his bed. He needed to hear that from you. I know. Briggs looked at her. You could have let him shoot me. Would have saved you the trouble of forgiving me. I haven't forgiven you. I know. Briggs smiled faintly. But you will. Because you're better than I ever was. Rachel didn't answer. They sat in silence for a moment. Then Briggs said, What are you going to do now? I don't know. Stay, Briggs said. This place needs you. Rachel shook her head. I came here to disappear. That's over. Good. Briggs's voice was firm despite his exhaustion. You were never meant to disappear. You were meant to save lives. And you're damn good at it. Before Rachel could respond, the door opened. Victoria stood there, looking shaken. Dawson, there's someone here to see you. Rachel frowned. Who? Hospital board, administration, legal. Victoria's expression was strange. And a reporter. Rachel's stomach sank. What? The shooter's arrest was caught on security footage, Victoria said quietly. Someone leaked it. You talking him down, disarming him, saving those people. It's already online, and it's going viral. Rachel stood slowly. No. They want to talk to you about what happened, about your background, about... Victoria hesitated. About who you really are. Rachel's hands were shaking again. This was it. The exposure she'd been avoiding, the attention she'd spent 8 months running from. I can tell them you are not available, Victoria said. Rachel looked at Briggs. He was watching her with something that looked like pride. No, Rachel said finally. I'll talk to them. Because hiding hadn't worked. Running hadn't worked. Maybe it was time to stop. She walked out of Bay 4 down the hallway toward whatever was waiting, and behind her Briggs whispered, That's my Shield 6. The conference room was packed. Hospital CEO, legal counsel, HR director, 3 board members. And sitting at the far end of the table, a woman with a recorder and a press badge. They all stood when Rachel entered. She didn't sit, just stopped inside the door and waited. The CEO spoke first. Ms. Dawson, thank you for joining us. Rachel said nothing. We've been reviewing the events of today, the CEO continued, and we need to discuss your actions. Which ones? Rachel's voice was flat. Saving the soldiers, performing emergency surgery, or stopping the shooter? The legal counsel cleared his throat. All of them, actually. There are liability concerns, protocol violations, questions about your credentials, and my credentials are fine, Rachel said. Navy Cross, 2 Silver Stars, 8 years as a combat medic with a 94% save rate in active firefights. Honorable discharge, current RN license, no disciplinary actions. Anything else you need to know? The room went silent. The reporter leaned forward. Is it true you were known as Shield 6? Rachel's eyes cut to her. That's classified. Not anymore. The reporter held up her phone. The military released a statement an hour ago, confirmed your service record. Called you one of the most decorated medics of your generation. Rachel's jaw tightened. The military never released that kind of information unless they wanted to, which meant someone high up had decided her cover was worth burning. Why didn't you tell us? The CEO's voice was genuinely confused. Why hide all of this? Because I didn't want to be a hero, Rachel said quietly. I wanted to be a nurse. You saved 8 lives today, maybe more. The CEO shook his head. That's not just nursing. That's my job, Rachel interrupted. It's always been my job. The board members exchanged glances. One of them, an older woman with steel gray hair, spoke up. Ms. Dawson, we owe you an apology. This hospital failed you. We failed to recognize your abilities, failed to support you, and nearly lost you because of our own blindness. Rachel didn't respond. We'd like to offer you a position, the woman continued. Trauma coordinator, full authority over emergency protocols, training staff in combat casualty care. Whatever you need to build the kind of program that can handle what happened today. Rachel stared at her. You spent 6 months trying to fire me. We were wrong. You humiliated me. We know. Rachel's hands clenched. And now you want me to fix the department that spent half a year treating me like I was broken? The woman met her eyes. Yes. The room waited. Rachel turned to leave. Ms. Dawson, I'll think about it, Rachel said without turning around. Then she walked out. The hallway was empty, quiet. She made it to the elevator, pressed the button, and waited. The doors opened. Brennan was inside. They stared at each other. Then Brennan stepped aside, made room. Rachel got in. The doors closed. They rode in silence for 3 floors. Then Brennan said, For what it's worth, I'll back whatever you decide. Rachel glanced at him. Why? Because I've spent today watching you do things I couldn't do in 100 years. And I realized something. Brennan's voice was quiet. I'm a good doctor, maybe even a great one. but you're something else entirely. The elevator dinged. Doors opened on the ground floor. Rachel stepped out, stopped, looked back. I'll need full authority, she said. No oversight, no second guessing. If I'm building this, I'm building it my way. Brennan nodded. Done. And you're going to publicly apologize in front of the whole staff for everything. Brennan's jaw tightened. Then he nodded again. Done. Rachel turned away. Then I'll consider it. She walked out of the hospital into the cool Portland night. Her shift had ended 6 hours ago. She should have been exhausted. Instead, she felt awake for the first time in 8 months. Her phone buzzed. A text from a number she didn't recognize. Saw the news? Knew you couldn't stay hidden forever. Proud of you. J.B. Briggs. Rachel almost smiled. Then her phone rang. Unknown number. She answered. Dawson? Miss Dawson, this is Lieutenant Colonel Sarah Vance, DOD Medical Services. I'm calling about a situation that requires your specific expertise. Rachel's stomach tightened. I'm not active duty. I know. But we have a team pinned down in hostile territory with multiple casualties and no medical support. The nearest base is 4 hours out. They won't make it. Rachel closed her eyes. How many? 12 soldiers, 3 critical. She could say no. She could hang up. She could go back to her apartment and pretend she never heard this. But somewhere across the world, 12 people were bleeding out, and she was the one who refused to let people die. Send me the coordinates, Rachel said. There's a chopper waiting at the base. Can you be there in 30? Rachel looked back at the hospital. At the building that had tried to break her. At the people inside who were just starting to understand who she really was. Then she looked up at the night sky. 20, she said, and started running. The helicopter was already spinning up when Rachel hit the tarmac at Joint Base Lewis McChord. A Black Hawk, side doors open, crew chief waving her forward with sharp, urgent gestures. She ducked under the rotors, hauled herself inside, and the bird was airborne before she'd even buckled in. Lieutenant Colonel Vance sat across from her, headset on, tablet in her lap. 50s, hard eyes. The kind of officer who'd seen enough missions go sideways to know when one was about to fall apart completely. She handed Rachel a headset. Situation's deteriorated. We've got confirmation of 12 personnel trapped in a compound outside Mosul. Heavy fire. No air support available for another 6 hours due to weather. They've been trying to hold position, but they're running out of options. Rachel's stomach dropped. What kind of casualties? 3 critical when we made contact 40 minutes ago. Could be more by now. Vance pulled up a satellite image on the tablet. A small compound surrounded by open terrain, no cover for 100 meters in any direction. The team was on a joint training op with local forces when they got ambushed. Someone sold them out. They've got limited ammo, limited medical supplies, and they're bleeding. Rachel studied the image. What's the plan? Fast rope insertion 2 clicks north. You go in with a 4-man security team, stabilize the wounded, and hold until we can extract. And if we can't hold? Vance's expression didn't change. Then you do what you do best. Keep them alive long enough for us to figure out a plan B. Rachel looked out the open door at the night sky rushing past. 18 hours ago, she'd been sitting at an intake desk processing sprained ankles. Now she was headed into a combat zone with a team she'd never met to save soldiers she'd never seen. This was insane. This was exactly what she'd been trying to escape. But 12 people were dying. What's my authority on the ground? Rachel asked. Total. Medical decisions are yours. Security will defer to your assessment on who moves when. Vance leaned forward. The team leader is Captain Morgan. Good officer. He'll listen. But his men are scared and they're hurt and they might not want to follow orders from a civilian. I'm not a civilian. You're not active duty either. Vance's voice was flat. Which means if this goes bad, the fallout lands on you personally. No rank to hide behind. No chain of command to distribute blame. You understand that? Rachel met her eyes. I understand. Good. Vance sat back. Then let's get you ready. The crew chief appeared with a tactical vest, already loaded with medical supplies. Rachel stripped off her scrubs, pulled on the vest over a borrowed BDU shirt. Tourniquets, pressure bandages, hemostatic gauze, chest seals. A combat medic's loadout, familiar as breathing. Vance handed her a sidearm. You qualified? Expert marksman, but I'm a medic, I don't... You might not have a choice. Vance waited until Rachel took the weapon. Captain Morgan's last transmission said they're surrounded. You go in there, you might have to fight your way back out. Rachel checked the magazine, chambered a round, holstered it. Vance nodded. ETA, 15 minutes. Get some rest. Rachel closed her eyes. Didn't rest. Just ran through protocols in her head. Trauma algorithms, drug dosages, contingency plans for when everything went wrong. Because everything always went wrong. The Black Hawk bucked suddenly. Rachel's eyes snapped open. Weather's getting worse, the pilot's voice crackled through the headset. We're going to have turbulence on approach. Vance cursed under her breath. Can you get us in? I can get you close. But the LZ's going to be hot. 15 seconds on the ground, Max. Rachel's hands tightened on her harness straps. Fast insertion meant less time exposed to fire. It also meant less time to orient, less time to get organized, less margin for error. The crew chief was already rigging the fast ropes. Rachel moved to the door, clipped in, watched the ground rush up through the darkness. The compound appeared like a ghost, small, square, lit by sporadic muzzle flashes. Tracer rounds arced across the open ground. Someone was returning fire from the rooftop. 30 seconds, the pilot called. Rachel's heart hammered. The four-man security team moved into position beside her, young, focused, scared in the way people got when they were about to drop into hell. 20 seconds. The helicopter banked hard. Rachel grabbed the door frame to keep from sliding. 10 seconds. Go, go, go. The ropes deployed. The security team dropped first, fast, professional, hitting the ground and moving to establish a perimeter. Rachel followed, her hands burning on the rope, her bad leg screaming when she landed. She rolled, came up running. Gunfire erupted to her left. The security team was already engaging, suppressing fire from a building 200 meters out. Rachel sprinted toward the compound entrance, keeping low, her medical pack slamming against her back with every step. The Black Hawk was gone, rotor wash fading into the night. They were alone. Rachel hit the compound wall, pressed flat against it, caught her breath. A soldier appeared in the doorway. 20-something, bloody, rifle up until he saw her vest. "Medics here!" he shouted back into the compound. Then to Rachel. 3 critical, 2 urgent, rest or ambulatory. Captain's inside. Rachel pushed past him. The compound interior was chaos. Soldiers crouched behind overturned furniture, returning fire through shattered windows. Shell casings littered the floor. Blood smeared the walls. And in the corner, 3 men lay motionless. Rachel dropped beside the first one. Entry wound to the chest, right side, sucking air. Tension pneumothorax. She ripped open a chest seal, applied it, heard the hiss of trapped air escape. His breathing eased slightly. "Get me his vitals," she snapped at the nearest soldier. The kid looked maybe 19. His hands shook as he fumbled with the blood pressure cuff. Rachel moved to the second casualty. Leg wound, femoral artery compromised, tourniquet already applied but positioned wrong. Too low, not tight enough. Blood still seeping around the edges. She repositioned it, cranked it until the bleeding stopped. The soldier screamed. "I know," Rachel said quietly, "but you need this or you die." He nodded, teeth clenched. The third critical was worse. Head wound, unconscious, shallow breathing. Rachel assessed quickly. Probable skull fracture, possible brain bleed. There was nothing she could do for him here. He needed a neurosurgeon and a CT scanner, and about 6 hours she didn't have. She moved to the urgent cases anyway. "Because you saved who you could." "Where's Captain Morgan?" she called out, a voice from the other side of the room. "Here." Rachel looked up. A man in his 30s moved toward her, limping badly, one arm hanging useless at his side. But his eyes were sharp and his voice was steady. "You're Shield 6, he said. "I'm Rachel. Sit down before you fall down." Morgan almost smiled. Then he sat. Rachel examined his arm. Dislocated shoulder, probably from a fall or blast impact. "This is going to hurt." "Everything hurts." She relocated the shoulder in one sharp motion. Morgan grunted but didn't scream. "Good," Rachel said. "Now talk to me." "What's the tactical situation?" Morgan rolled his shoulder, testing it. "We're surrounded. Maybe 30 hostiles spread across 3 buildings. They've got us pinned. We tried to break out twice, but they cut us down. Lost 2 men that way." Rachel's jaw tightened. "Air support?" 6 hours minimum. Maybe longer if this weather holds. Ground reinforcements? Nothing close enough to matter. Morgan met her eyes. We're on our own until dawn. Maybe after. Rachel looked around the room. 12 soldiers, 3 critical, 2 urgent, the rest exhausted, running on adrenaline and fear, against 30 hostiles with superior position and unlimited ammunition. The math didn't work. Then we need to change the equation, Rachel said. Morgan frowned. How? By making them think we're already dead. She stood, walked to the window, looked out at the surrounding buildings. The gunfire had slowed. The hostiles were conserving ammunition, waiting for dawn when they could see clearly enough to finish this. They were confident, comfortable. That was their mistake. Rachel turned back to Morgan. How many smoke grenades do you have? Maybe 8. Why? Because we're going to make them think this compound just went up in flames. We throw smoke, kill the lights, and use the cover to reposition, move the wounded to the basement, fortify, make them waste resources clearing a building we're not even in anymore. Morgan stared at her. That's insane. You have a better idea? He didn't. Then we do it now, before they decide to rush us. Morgan hesitated for maybe 3 seconds. Then he nodded. You heard her. Smoke and reposition. Move the wounded first, quietly. The soldiers moved. Rachel coordinated the medical evacuations personally, stabilized IVs, secured airways, made sure nothing would shift or dislodge during movement. The 2 urgent cases could walk with support. The 3 critical cases had to be carried. They worked in near silence, communicating with hand signals and whispers. The basement was small, cramped, but defensible. 1 entrance, thick walls, minimal exposure. Morgan positioned his remaining able-bodied soldiers at the choke points. 7 men, against 30. Still bad odds, but better than before. Ready? Morgan asked. Rachel nodded. Morgan pulled the pin on the first smoke grenade, tossed it through the window, then another, and another. Gray smoke billowed out, thick and choking. Within seconds, the compound was invisible. The lights went out. Rachel heard shouting from the hostile positions. Confusion. Then gunfire, wild, panicked, shooting at shadows. They were buying it. Move, Morgan whispered. They descended into the basement. Rachel went last, pulling the door shut behind her, wedging it with debris. Then they waited. Above them, the gunfire intensified. The hostiles were advancing, probably thinking the smoke was from a fire or an explosion. They'd clear the compound room by room, find it empty, and then... The explosion shook the building. Rachel grabbed the wall to keep from falling. Dust rained down from the ceiling. What the hell was that? One of the soldiers hissed. Morgan was already on his radio, listening. His face went pale. They just rocketed the compound, trying to collapse it. Another explosion, closer. The basement ceiling cracked. We need to get out, Rachel said. There's nowhere to go, Morgan replied. We go up, they shoot us. We stay here, the building comes down on top of us. Rachel's mind raced. They'd bought maybe 20 minutes with the smoke trick. But now the hostiles knew the building was empty, and they were bringing the whole thing down anyway. Think. Her eyes fell on the far wall of the basement, old stone crumbling in places, and behind it, Is there a tunnel? She asked. Morgan blinked. What? These compounds were built during the occupation. A lot of them have smuggling tunnels. Is there one here? Morgan looked at the wall, then at one of his soldiers. Davis, you mapped this place during recon. Anything? Davis nodded slowly. There was mention of an underground passage, but it was supposed to be collapsed. Supposed to be? Rachel was already moving toward the wall, running her hands over the stone. Where? Davis pointed. There, behind those crates. 2 soldiers shoved the crates aside. Behind them, half hidden by debris, was a gap in the wall. Narrow, dark, but open. Rachel grabbed a flashlight, shined it into the opening. A tunnel, maybe 4 feet high, disappearing into blackness. Could lead anywhere, Morgan said, or it could lead out. Rachel looked at him. We can't stay here. Another explosion. The ceiling groaned. Morgan made the call. We go. Wounded first. Davis, you're on point. I'll bring up the rear. They moved fast. Rachel helped carry the critical cases, navigating the cramped tunnel with the unconscious soldiers balanced on makeshift stretchers. The tunnel smelled like earth and rot. Water dripped from the ceiling. Rats scattered at their approach. Davis led them forward, his flashlight cutting through the dark. 50 meters. 100. The tunnel twisted, descended, rose again. Then it ended. A wall of rubble blocked the exit, collapsed, just like Davis had said. "No," Morgan whispered. "No, no, no." Rachel pushed forward, examined the collapse. Not solid. Loose rocks, dirt, some kind of support beam that had given way. And beyond it, "I can hear wind," she said. Morgan looked at her. "What?" "There's air moving, which means there's a gap." Rachel started pulling rocks away. "Help me!" They dug. All of them. Soldiers with bleeding hands and broken ribs and exhaustion that should have dropped them hours ago. They dug because the alternative was dying in a tunnel or going back to a building that was actively being demolished. Rachel's fingers bled. Her leg throbbed. She ignored it all and kept digging. Behind them, another explosion echoed down the tunnel. The hostiles were getting closer. "Come on," Rachel muttered. "Come on." Her hand broke through. Open air. "I've got it," she shouted. "There's a way out." They widened the gap, pulled the wounded through first, then the ambulatory soldiers. Morgan went last, squeezing through just as the tunnel behind them collapsed completely. They stumbled out into the open air. It was still night. They were maybe half a mile from the compound, behind a ridge that blocked them from sight. In the distance, fire lit up the sky where the compound was burning. Morgan did a head count. "Everyone's here. We're intact." Rachel sank to the ground. Her hands were shaking. Her breath came in gasps. They'd made it, for now. But they were still surrounded, still hunted, and dawn was coming. Morgan was on the radio calling for extraction. His voice was tight, controlled, but Rachel could hear the strain. "Say again, Overwatch. You're breaking up." Static. Then a voice, faint. "Negative on extraction. Weather's too bad. Earliest window is 0800. Morgan looked at his watch. 4 hours. Rachel did the math. 4 hours in hostile territory with 3 critical casualties, limited ammunition, and an enemy that would be searching for them the moment they realized the compound was empty. "We need a defensive position," she said. Morgan scanned the terrain. "There. That outcropping. High ground, good sight lines, cover from 3 sides." They moved. Rachel set up a triage area in the lee of the rocks, reassessed the wounded. The chest seal patient was stable. The leg wound patient was holding. But the head trauma patient, his breathing had changed, slower, more irregular. Rachel checked his pupils, fixed and dilated. No. She started CPR anyway, compressions, breaths, checking for response. Nothing. "Come on," she whispered. "Don't you quit on me." She worked for 10 minutes, 15. Morgan's hand landed on her shoulder. "Rachel, he's gone." Rachel kept compressing. "He's not." "He is." Rachel's hand stilled. She looked down at the soldier's face. Young, maybe 22. Someone's son. Someone's friend. Dead. She'd lost people before, dozens of them, but it never got easier. She sat back, wiped blood from her hands. Marked the time. 3:47. Morgan nodded quietly. Around them, the other soldiers watched in silence. They'd all known this was coming. But knowing didn't make it hurt less. Rachel stood, moved to the next patient, because the others were still alive, and that's what mattered. The night dragged on. The hostiles found the tunnel around 0430. Rachel heard the shouting, saw flashlights in the distance. They were tracking, following the trail. Morgan positioned his soldiers. "They find us. We make them pay for it." But the hostiles were cautious now. They'd been burned once by the smoke trick. They weren't rushing in blind. They were flanking. Rachel saw the movement, shadows circling around the outcropping, using the terrain for cover. Smart, disciplined. "They're surrounding us," she said quietly. Morgan saw it too. "We can hold the high ground, but if they get on all sides..." He didn't need to finish. If they got surrounded, it was over. "How long until extraction?" Rachel asked. Morgan checked his watch. 3 hours. Too long. Rachel looked at the wounded, at the soldiers who could barely hold a rifle, at the impossible situation they were in. Then she made a decision. "Give me your radio," she said. Morgan frowned. "Why?" "Because I'm calling in a favor." She took the radio, switched to a frequency she hadn't used in 8 months, hesitated, then keyed the mic. Broken Arrow, this is Shield 6. Do you copy? Static. Then, Shield 6, Broken Arrow, we copy. What's your status? Rachel recognized the voice. Commander Ellis, her old unit's CO. Surrounded. 3 hours to extraction. 12 personnel, 2 critical. I need fire support. Negative Shield 6, all air assets are grounded due to weather. Then get them ungrounded. A pause. Say again? I said get them in the air. Rachel's voice was hard. I've got wounded who won't make it 3 hours. I've got hostiles closing on our position, and I've got a team that trusted me to keep them alive. So either you find me fire support or you explain to their families why you left them to die. Silence on the line. Then Ellis said, Stand by. Rachel waited. The hostiles were getting closer. She could hear them moving, coordinating, preparing for an assault. Morgan was watching her. What did you just do? My job, the radio crackled. Shield 6, Broken Arrow, we've got 2 Apaches spinning up. ETA, your position 30 minutes. Mark your location with IR strobes. Rachel exhaled. Copy that, Broken Arrow. Marking now. Morgan was staring at her. You just ordered attack helicopters into a weather blackout. I asked. They said yes. They could crash. They could. But they won't. Rachel met his eyes. Because if I learned anything in 8 years, it's that the people who fly those birds are better at their jobs than anyone gives them credit for. Morgan almost smiled. Then he turned to his team. You heard her? Mark the position and get ready. When those birds arrive, we move on the wounded immediately. The next 30 minutes were the longest of Rachel's life. The hostiles probed their defenses twice. Both times, Morgan's team drove them back. But ammunition was running low, and the enemy knew it. They were waiting for the right moment to rush. Then Rachel heard it. The low thump of rotor blades cutting through the storm. The Apaches came in fast and low, their infrared targeting systems painting the hostile positions with invisible light. Rachel saw the moment the hostiles realized what was happening, saw them scatter, try to run. The Apaches opened fire. Hellfire missiles streaked across the night sky. Buildings exploded. The .30mm chain guns roared, chewing through cover like it was paper. In 90 seconds, the battlefield was transformed. The hostiles that survived were running. The ones that didn't were gone. Rachel grabbed the radio. Broken Arrow, Shield 6. Targets neutralized. Request immediate medevac for wounded. Copy Shield 6. Medevac inbound. ETA 8 minutes. Morgan looked at her with something like awe. Who the hell are you? Rachel didn't answer, just moved to the wounded, started prepping them for transport. The medevac birds arrived exactly on schedule. 2 Blackhawks, side doors open, medics already moving before the skids touched ground. Rachel transferred her patients personally, rattling off vitals and interventions in the clipped shorthand of combat medicine. The medevac medics nodded, asked no questions, just took over and got the wounded aboard. In under 3 minutes, the critical cases were airborne. Morgan and his team loaded up on the second bird. He offered Rachel his hand. Thank you. Rachel shook it. Just doing my job. No. Morgan's grip was firm. You saved us. All of us. Rachel didn't know what to say to that, so she just nodded and climbed aboard. The Blackhawk lifted off, banking hard away from the compound. Through the open door, Rachel could see the sun rising over the horizon, orange and red and beautiful. She closed her eyes. 12 soldiers extracted, 2 critical casualties saved, 1 KIA. Not perfect, but alive. The flight back to base was quiet. Rachel sat with her head against the bulkhead, feeling every bruise, every cut, every hour of the last 24 hours settling into her bones. When they landed, Lieutenant Colonel Vance was waiting on the tarmac. Rachel climbed out, her legs barely holding her up. Vance walked over, studied her. Good work. Rachel nodded. You know the media's going to have a field day with this, Vance said. Civilian nurse drops into a combat zone, saves 12 soldiers, calls in an airstrike. It's already leaking. Rachel's stomach sank. I didn't do this for publicity. I know, but you're going to get it anyway. Vance handed her a phone. You've got about 100 missed calls, including one from the Secretary of Defense. Rachel stared at the phone. What does he want? To thank you, to offer you a commission, to make you the face of military medicine reform. Vance's expression was unreadable. They want to put you on recruiting posters. Rachel handed the phone back. I'm not interested. They're going to ask anyway. Let them ask. Vance almost smiled. You're going to be impossible to work with, aren't you? Probably. Good. Vance gestured toward the base medical center. Get yourself checked out, then get some sleep. We'll debrief in 6 hours. Rachel started walking, made it maybe 10 steps before her leg gave out. She caught herself on a nearby vehicle, breathing hard, the pain finally breaking through the adrenaline. A medic appeared at her side. Ma'am, let me help. I'm fine. You're bleeding through your pants. Rachel looked down. The medic was right. Her old injury had reopened, probably during the tunnel collapse. Blood soaked through the BDU fabric. Okay, Rachel admitted. Maybe I need help. The medic got her to the medical center. A doctor Rachel didn't know cleaned and re-stitched the wound, muttering about scar tissue and nerve damage and how she should have been on medical leave months ago. Rachel let him talk, didn't argue. When he finished, she was given a bed in the recovery ward, told to rest. She lay down, closed her eyes, and dreamed of Kandahar. She woke 6 hours later to voices outside her door. Can't just barge in there. Watch me. The door opened. Dr. Brennan walked in, still wearing his white coat, looking completely out of place on a military base. Victoria was behind him, along with 2 people Rachel didn't recognize, a man in a suit and a woman with a hospital administrator badge. Rachel sat up slowly. What are you doing here? Brennan stopped at the foot of her bed. We flew out this morning, soon as we heard. Heard what? That you'd gone into a combat zone. Victoria's voice was tight. That you'd been shot at, that you'd... She stopped. We thought you were dead. Rachel didn't know what to say to that. The man in the suit stepped forward. Ms. Dawson, I'm Richard Caldwell, legal counsel for Mercy Point Hospital. We need to discuss the situation back home. Rachel's stomach dropped. What situation? Dr. Brennan's suspension has been formalized by the board, pending investigation into his conduct toward you and several other staff members. Rachel looked at Brennan. He wouldn't meet her eyes. Additionally, Caldwell continued, the board has voted to offer you the position of Chief of Trauma Services. Full authority, complete restructuring mandate, and a salary commensurate with your unique qualifications. Rachel stared at him. You flew across the country to offer me a job? We flew across the country, Victoria said quietly, because we realized we almost lost something irreplaceable, and we're not going to make that mistake again. Brennan finally looked up. I was wrong. About everything. And I'm sorry. His voice was rough. You deserve better. From all of us. Rachel's throat tightened. The administrator spoke up. The board is prepared to issue a public apology, full accountability for the discriminatory treatment you endured. We're also establishing new protocols to prevent this from happening to anyone else. Rachel looked at each of them. At the people who'd spent months treating her like she didn't matter, now standing in a military hospital, offering her everything she'd been denied. It should have felt like victory. Instead, it just felt exhausting. I need to think about it, she said. Caldwell nodded. Of course. Take all the time you need. They left. All except Victoria. She sat down in the chair beside Rachel's bed. You didn't have to go. Rachel looked at her. Yes, I did. Why? Because 12 people needed help and I was the only one who could give it. Victoria was quiet for a moment. Then she said, that's why we need you. Not because of your credentials or your medals or your combat experience. Because you're the person who runs toward the crisis when everyone else is running away. Rachel closed her eyes. I'm tired of running toward crises. I know. Victoria's voice was gentle. But I don't think you know how to stop. She wasn't wrong. Victoria stood. The offer stands. Whenever you're ready. She left. Rachel lay back down, stared at the ceiling. Her phone buzzed. Another call from a number she didn't recognize. She almost didn't answer. Then she saw the area code, Washington, D.C. She picked up. Dawson? Ms. Dawson, this is General Patricia Hawthorne, Joint Chiefs of Staff. Do you have a moment? Rachel sat up. Yes, ma'am. I've been reviewing your actions over the past 48 hours. The convoy rescue, the active shooter incident, the combat extraction. A pause. I'm impressed. Thank you, ma'am. I'm also concerned. Hawthorne's voice hardened. You're not active duty. You have no official standing, and yet you've been involved in 3 military operations in under 2 days. That's a problem. Rachel's jaw tightened. I was asked to help. I know. And you did. Brilliantly. Another pause. Which is why I'm offering you a direct commission. Major, Army Medical Corps. Immediate assignment to a new rapid response unit we're developing. Rachel's heart stopped. Ma'am, Before you answer, understand what I'm offering. This isn't a desk job. It's not a recruiting poster. It's frontline trauma response in the worst situations we face. You'd be dropped into active combat zones with minimal support and maximum risk. It's everything you've been running from. I know. And I'm offering it anyway, because we need people like you, people who don't quit when it gets hard. Rachel looked down at her hands, still covered in dried blood, still shaking slightly. She'd spent 8 months trying to hide from this, trying to be normal, trying to convince herself she could be just a nurse at a quiet hospital living a quiet life. But quiet wasn't who she was. It never had been. Can I have time to think about it? Rachel asked. You have 24 hours, Hawthorne said. After that, the offer expires. The line went dead. Rachel set the phone down, lay back, closed her eyes. 2 offers, 2 futures, 2 completely different lives. She could go back to Mercy Point, build a trauma program, train doctors, save lives in a controlled environment where the stakes were high but the chaos was manageable. Or she could go back to war, back to the impossible situations, back to being Shield 6. She didn't know which one scared her more. Her phone buzzed again, a text this time, from Briggs. Heard about the extraction, knew you still had it in you. Whatever you choose it for yourself. Not for them, not for the mission. For you. You've earned that much. Rachel read it twice, then put the phone away. The next morning, she was discharged from the medical center. A car was waiting to take her back to Portland. She got in. Halfway to the airport, her phone rang. Unknown number. She answered. Dawson? Rachel, it's Morgan. I wanted to call and... He paused. I wanted to say thank you again for what you did. You already thanked me. I know, but I also wanted to tell you something. Morgan's voice was serious. Hayes made it through surgery, the kid with the abdominal wound. Doctors said if you hadn't operated when you did, he would have been gone before the medevac arrived. Rachel's throat tightened. Good. And the lieutenant with the splenic injury? He's stable, going to make a full recovery. That's good to hear. You saved us, Morgan said quietly. All of us. And I think you need to hear that, because I get the feeling you don't let yourself believe it very often. Rachel didn't know what to say. Whatever you decide to do next, Morgan continued, just know that 12 soldiers are alive because of you, and that matters. The line went dead. Rachel stared out the window as the car drove on. By the time she got back to Portland, the media was camped outside her apartment. Cameras, reporters, satellite trucks. They spotted her the moment the car pulled up. She didn't get out. Drive past, she told the driver. He did. Rachel pulled out her phone, called Victoria. It's me, she said when Victoria answered. I need a place to stay, somewhere quiet. Come to my house, Victoria said immediately. I'll text you the address. Rachel ended up in a small Craftsman in northeast Portland. Victoria had cleared out her guest room, stocked the fridge, and left Rachel alone. For the first time in 48 hours, Rachel had silence. She sat in the guest room, looked at her phone, at the 2 futures waiting for her decision. Then she noticed something on the nightstand. A folder, marked with a sticky note in Victoria's handwriting. Thought you should see this. Rachel opened it. Inside were personnel files, staff complaints, documentation of Brennan's misconduct going back 3 years. Not just toward Rachel, toward other nurses, residents, anyone he perceived as weak. And at the bottom, a letter from the hospital board, an official apology, a commitment to reform, and a promise. This ends now. Rachel set the folder down. Her phone buzzed. A text from an unknown number. This is Davis. Morgan gave me your number. The whole team wanted me to tell you, if you ever need anything, we've got your back. Always. Then another text. From Patel. the resident who'd helped her during the convoy rescue. Thank you for teaching me what real medicine looks like. And another, from the young nurse who'd been terrified in Trauma Bay 1. You inspired me to be braver. I'm staying in emergency medicine because of you. Rachel stared at the messages, at the lives she'd touched without even realizing it. She thought about Mercy Point, about the broken system that needed fixing, about the people who needed someone to fight for them the way she'd fought for those soldiers. Then she thought about the military, about the missions that would keep coming, about the soldiers who'd die without someone like her there to save them. Both mattered. Both needed her. She couldn't choose both. Her phone rang. General Hawthorne. Rachel looked at it. Let it ring 3 times. Then she answered. This is Dawson. I need your answer, Hawthorne said. Rachel took a breath, made her choice. But before she could speak, a massive explosion rocked the house. The windows blew inward. Rachel hit the floor, covering her head as glass rained down. Smoke poured through the shattered frames. She crawled to the doorway, looked out into the street. Victoria's car was engulfed in flames. And standing in the middle of the street, staring directly at the house, was a figure Rachel recognized. The shooter from the hospital, the one who'd tried to kill Briggs. He was supposed to be in custody. He raised a weapon. Rachel dove back inside as bullets tore through the walls. Her phone was still connected. She could hear Hawthorne shouting. Dawson! What's happening? Dawson! Rachel grabbed the phone. I'm under fire. Send... The line went dead. She was alone, unarmed, trapped in a burning house. And the man who wanted her dead was walking toward the front door. Rachel rolled left as another burst of gunfire chewed through the doorframe where she'd been crouching. Splinters exploded across her face. She scrambled backward into the kitchen, her bad legs screaming, her mind already running calculations. Exits, cover, weapons, anything she could use. Victoria's house was small. 2 bedrooms, 1 bath, kitchen opening to a dining area. The back door led to a fenced yard with nowhere to run. Front door was suicide. Windows were compromised. She was boxed in. The shooter's footsteps echoed on the front porch. Slow, deliberate. He knew she was trapped. I just want to talk, he called out. His voice was different than it had been at the hospital, calmer, more controlled, like he'd found clarity in the chaos. Rachel didn't answer. Talking meant giving away her position. She moved to the kitchen counter, staying low. Knife block. She grabbed the largest blade, tested its weight. Not ideal, but better than nothing. You don't remember me, do you? The shooter continued. His footsteps moved into the living room. Glass crunched under his boots. Syria, 8 months ago. You were there when they pulled us out. Rachel's blood went cold. Syria. The mission Briggs had mentioned. The one where he'd ordered the retreat. My name is Corporal Danny Reeves, the man said. I was on that extraction team, the one your precious colonel abandoned. Rachel's mind raced. Reeves. She didn't remember the name, but she remembered Syria, the chaos, the casualties, the soldiers who'd come back broken. He left my brothers to die, Reeves said, his voice cracking. And you were part of it. You were with him. I wasn't there, Rachel said quietly. The footsteps stopped. Liar. Reeves's voice hardened. I saw the records. Shield 6 was listed on the medical support team for that op. I was listed, but I wasn't deployed. I'd already resigned by then. Silence. Then, you're lying. Check the dates. I left active duty 9 months ago. Whatever happened in Syria, I wasn't part of it. More silence. Rachel could hear him breathing, hear the uncertainty creeping into the rhythm. But you know what happened, Reeves said finally. Briggs told you. I saw you talking to him at the hospital. Rachel shifted position, moving toward the back hallway. He told me he made a call, that he pulled the team out to save lives. He pulled out to save himself, Reeves's voice rose. He left 3 men behind because extraction was getting too hot, and he didn't want to risk his own neck. Rachel reached the hallway. The bathroom was to her left, the guest bedroom to her right. Both had windows, but they were small and Reeves would hear her breaking them. So you escaped custody, Rachel said, keeping him talking, buying time. Bombed a civilian's car. Came here to finish what you started. That going to bring your friends back? No. Reeves sounded closer now. But it'll make someone pay. Rachel heard him enter the kitchen. She pressed against the wall, knife ready, her breath shallow. "You want someone to pay?" she said. "Then pay the right person. Briggs is dying anyway. Cancer. 6 months, maybe less. You shoot him now, you're just saving him the suffering." "I don't care." "You should." Rachel's voice was hard. "Because if you kill me, you lose the only witness who can prove what really happened." Reeves paused. "What are you talking about?" Briggs lied in his after-action reports. Made it sound like the retreat was tactically sound. But if you want the truth to come out, you need someone who knows how to read between the lines. Someone who's seen enough mission reports to know what gets buried. She was gambling, had no idea if she could actually prove anything, but Reeves didn't know that. "Why would you help me?" Reeves asked. Reeves geeked. "Because he lied about me too. Told people I failed in Kandahar when the failure was his." Rachel moved silently down the hallway. "And I'm tired of carrying his mistakes." Another pause. Longer this time. "Come out where I can see you," Reeves said. "Put the gun down first." "Not happening." "Then we're at an impasse." Rachel heard sirens in the distance. Someone had called the police. That gave her maybe 3 minutes before this turned into a hostage situation or a shootout. She needed to end this now. "Reeves," she said quietly, "you came here because you're hurting, because you lost people and nobody held the right person accountable. I understand that. I've been there. You don't understand anything. I understand that shooting me doesn't change what happened, and it doesn't get you justice. It just makes you a murderer." The sirens were getting closer. Reeves's breathing was ragged now. I don't know what else to do." "You put the gun down. You surrender, and I help you get the truth out. On record. Where it matters." "They'll lock me up." "Probably, but you'll be alive, and the people who need to hear what happened will hear it." Rachel eased toward the bedroom window. If she could get it open quietly. The floorboard creaked. Reeves spun into the hallway, rifle up. Rachel lunged. She hit him low, driving her shoulder into his midsection, knocking him off balance. The rifle discharged, deafening in the confined space, the round punching through the ceiling. Rachel grabbed for the weapon, but Reeves was stronger, trained, and he threw her off. She hit the wall hard, her vision swimming. Reeves brought the rifle around. Rachel threw the knife. It wasn't a perfect throw. The blade tumbled, hit him handle first in the chest, but it was enough to make him flinch, enough for Rachel to close the distance again. She grabbed the rifle barrel, shoved it up as he fired. The round went wide. She twisted, using her body weight to wrench the weapon from his grip. It clattered to the floor. They both dove for it. Rachel got there first, but Reeves grabbed her ankle, yanked her back. She kicked, connected with his face, heard something crunch. He let go. She scrambled forward, fingers closing around the rifle. Reeves tackled her from behind. They rolled, struggling for control. Reeves was bigger, stronger, but Rachel had fought for her life in worse situations. She got an elbow into his throat, made him gag, shoved him off. She came up with the rifle. Reeves was on his knees, blood streaming from his nose, hands raised. "Don't!" he whispered. Rachel kept the rifle trained on him. Her hands were steady despite the adrenaline. "Stay down." He did. The front door crashed open. Portland PD flooded in, weapons drawn, shouting commands. "Drop the weapon. Hands up. Now." Rachel set the rifle down carefully, raised her hands. "I'm the homeowner's guest. The shooter is on the floor. He's disarmed." The officers swarmed Reeves, cuffed him, dragged him upright. One of them turned to Rachel. "You okay, ma'am?" Rachel nodded, couldn't speak. Her legs gave out. An officer caught her before she hit the floor. Hey, medic! We need a medic!" Rachel pushed him away. "I'm fine. Just give me a second." She leaned against the wall, breathing hard, her whole body shaking now that the fight was over. Through the broken window, she could see news cameras setting up across the street. More reporters. More attention. She closed her eyes. This was never going to end. They took her to the hospital. Not Mercy Point, somewhere smaller, quieter. A doctor checked her over, declared her bruised but unbroken. A detective interviewed her for 2 hours, taking her statement about Reeves, about Syria, about everything. By the time they let her go, it was almost midnight. Victoria was waiting in the lobby. Her face was pale, her eyes red. "Your car," Rachel started. "I don't care about the car." Victoria crossed the room, pulled Rachel into a hug. "I thought he was going to kill you." Rachel stood stiffly, unsure how to respond. She wasn't used to people caring whether she lived or died. "I'm okay," she said finally. Victoria pulled back, studied her face. "No, you're not, but you will be." A man in a suit approached, FBI badge clipped to his belt. "Ms. Dawson, I'm Agent Carver. We need to talk about Corporal Reeves and his allegations." Rachel wanted to refuse, wanted to walk out and never look back. But 12 men had died in Syria. And if Briggs had lied about that the way he'd lied about Kandahar, then those men deserved better. "Okay," she said, "let's talk." They went to a conference room. Carver laid out files on the table, mission reports, casualty lists, communications logs from the Syria extraction. "Reeves claims Colonel Briggs ordered a premature withdrawal that resulted in 3 KIA, Carver said. But the official report says the withdrawal was tactically necessary due to overwhelming hostile forces. Rachel scanned the documents, found the medical logs. "Who signed off on the casualty assessments?" Carver checked. "A Captain Ellis. He was Briggs's medic," Rachel said quietly. "His direct report. Which means if Briggs wanted the assessment to say something specific, Ellis would have written it." Carver's expression sharpened. "You're saying the reports were falsified?" "I'm saying they were shaped to match a narrative. There's a difference." Rachel pointed to a line in the communications log. "Look here. The extraction order came through at 1847, but the last casualty wasn't confirmed until 1903, 16 minutes after Briggs pulled out." "Meaning what?" "Meaning those men were still alive when he left. They died waiting for support that never came." Carver sat back. "That's speculation. It's pattern recognition." Rachel met his eyes. "I've read enough after-action reports to know what a cover-up looks like, and this has all the markers." Carver was quiet for a long moment. Then he said, "If what you're saying is true, Colonel Briggs committed dereliction of duty. Maybe worse." "He's dying," Rachel said. "Cancer. He won't live long enough to stand trial." "Doesn't matter. The truth matters." Carver gathered the files. "I'll open an investigation. See where it leads." Rachel nodded, stood to leave. "Ms. Dawson," Carver said, "one more thing. Reeves mentioned you promised to help him get the truth out. Did you mean that?" Rachel looked back. "I meant it." "Good. Because he's asking for you. Won't talk to anyone else." Rachel closed her eyes. "When?" "Tomorrow, if you're willing." She should have said no, should have walked away from this whole mess. But Reeves had lost 3 brothers because someone made a bad call and then lied about it. And Rachel knew exactly what that felt like. "I'll be there," she said. The next morning, Rachel sat across from Danny Reeves in a federal holding cell. He looked smaller than he had during the attack, younger, more broken. Without the rifle and the rage, he was just a scared kid who'd lost everything. "Thank you for coming," he said quietly. Rachel nodded. "I said I'd help. I meant it." "Why?" Reeves looked up, his eyes red. "I tried to kill you." "Because you were right. About Briggs. About the lies." Rachel leaned forward. "But you were wrong about how to fix it." Reeves's hands were shaking. "I just wanted someone to listen, to care that they died for nothing." "They didn't die for nothing. They died because someone made a mistake and then tried to hide it." Rachel's voice was firm. "And we're going to make sure everyone knows it." Over the next hour, Reeves walked her through everything. The mission parameters. The ambush. The moment Briggs ordered the withdrawal despite clear comms that men were still alive and pinned down. The way the after-action reports had been sanitized to remove any mention of the premature extraction. Rachel took notes, asked questions, built a timeline that contradicted the official narrative in every meaningful way. When they finished, Agent Carver was waiting outside the cell. "We've got enough," he said. "I'm forwarding this to the Inspector General. They'll handle it from here." Rachel stood, started to leave. "Ms. Dawson," Reeves called out. "What happens to me?" Rachel looked back. "You answer for what you did, the shooting, the attack, all of it. But at least the truth comes out, too." Reeves nodded slowly. "That's more than I thought I'd get." Rachel left the federal building and walked straight into a media circus. Cameras. Microphones. Reporters shouting questions. "Miss Dawson, is it true you disarmed an armed attacker?" Are the allegations against Colonel Briggs accurate? What's your response to the hospital board's job offer? Rachel pushed through without answering. A car was waiting at the curb, military plates. The door opened and Lieutenant Colonel Vance stepped out. "Get in," she said. Rachel did. The car pulled away from the curb, leaving the reporters behind. Vance handed Rachel a tablet. "You need to see this." The screen showed a news broadcast. The anchor was reading from a statement. Colonel James Briggs has been removed from all advisory positions pending investigation into allegations of misconduct during a 2025 military operation in Syria. The investigation was prompted by testimony from decorated combat medic Rachel Dawson, also known by her call sign Shield 6. Rachel's stomach dropped. "They used my name."
They used everything. Vance pulled up another article. Your front page news, the medic who took down a shooter, saved 12 soldiers, and exposed a cover-up. The media is calling you a hero. I know what you're going to say, that you're not a hero, that you were just doing your job. Vance's voice was hard. But the rest of the world doesn't care. They want someone to believe in, and right now, that's you. Rachel stared out the window. I didn't ask for this.
Nobody asked for it, but you've got it anyway. So the question is, what are you going to do with it? The car pulled up to Joint Base Lewis McChord. Rachel hadn't realized that's where they were going. Vance led her through security into the administrative building, up to an office on the 3rd floor. General Hawthorne was waiting inside. She stood when Rachel entered. "Ms. Dawson, glad you're still alive." Rachel almost smiled. "Makes 2 of us." Hawthorne gestured to a chair. "Sit. We need to discuss your future." Rachel sat. "The offer I made still stands," Hawthorne said. "Direct commission, rapid response unit. But I need to know you understand what you'd be signing up for. Because after the last 48 hours, you're not just another medic. You're a symbol." Rachel's jaw tightened. "I don't want to be a symbol." Too late. Hawthorne pulled up a video on her computer, turned it toward Rachel. The footage showed Rachel in Trauma Bay 1 performing emergency surgery on Hayes. It had been taken from a security camera, leaked to the media. The clip had 17 million views. "You've got people calling for medals," Hawthorne said. "Congressional hearings, reform legislation, all because you did your job better than anyone thought possible." Rachel looked away from the screen. "What do you want from me?" "I want you to lead." Hawthorne's voice was firm. "I want you to take that commission and build something better. A medical response team that doesn't fail the way Briggs's teams failed, that doesn't leave people behind." Rachel's hands clenched. "And if I say no, then you walk away. Go back to civilian life. Take the job at Mercy Point, or don't. That's your choice." Hawthorne paused. "But I think you already know you can't walk away. Because every time you try, someone ends up dying who you could have saved." The words hit harder than Rachel wanted to admit. "I need time," she said. "You have until end of business today." Hawthorne stood. "Choose wisely." Rachel left the base and went to the one place she knew she'd find clarity. Mercy Point Hospital was quieter than she'd ever seen it. The media had moved on to other stories. The staff was back to their routines. Everything looked normal, but Rachel knew better. She found Victoria in her office, reviewing schedules. "You came back," Victoria said, not looking up. "I came to think." Victoria set down her tablet. "About the job offer." "About everything." Rachel sat down. "Hawthorne wants me to go back to the military. You want me to stay here, and I don't know which choice is right." "There is no right choice," Victoria said quietly. "There's just the choice you can live with." Rachel looked around the office. At the schedules on the wall, the certifications, the photographs of staff who'd been here for decades. Stable? Predictable. Safe. "I spent 8 months trying to be normal," Rachel said. "Trying to prove I could do regular nursing without the combat, without the chaos. And I failed." "You didn't fail. You were punished for being different." "Same result." Rachel's voice was hollow. "I came here to hide from who I was, and the moment things got hard, that person came right back." Victoria leaned forward. "Good." Rachel looked at her. "You're not meant to hide," Victoria said. "You're meant to be exactly who you are. Someone who runs toward the crisis, who makes impossible calls and saves lives nobody else can save. That's not a flaw. That's who you are. Rachel's throat tightened. So stop trying to be something you're not, Victoria continued, and start deciding what you want to build, here or there, civilian or military. Just make it count. Rachel stood, walked to the window, looked out at the ER entrance where, days ago, military helicopters had landed and changed everything. If I stay, she said slowly, I need full authority, complete restructuring, no interference from administration or board members or anyone who thinks they know better. You'll have it. And I need Brennan publicly disciplined, not just suspended, actual consequences. Already done. He's been terminated, effective yesterday. Rachel turned. What? The board reviewed his conduct, found a pattern of discrimination and abuse going back years. He's out, and he won't work in medicine again. Rachel didn't know how to feel about that. Part of her felt vindicated. Part of her just felt tired. What about the others? She asked. The nurses he bullied, the residents he destroyed. We're reaching out to all of them, offering counseling, restitution, whatever they need. Victoria's expression was grim. We failed them. We're trying to make it right. Rachel nodded slowly. So what's it going to be? Victoria asked. Are you staying? Rachel looked out the window again, thought about the soldiers in Syria, the ones Briggs had left behind. The pattern of failures that kept repeating because nobody had the courage to break it. I'll give you an answer by tonight, she said. She left Mercy Point and went to see Briggs. He'd been moved to a hospice facility, a quiet place with gardens and soft lighting and the kind of peace reserved for people who were dying. Rachel found him in a room overlooking a courtyard, sitting in a wheelchair, thinner than he'd been days ago. Came to gloat? He said when he saw her. Rachel sat down across from him. Came to understand. Understand what? Why you lied about Kandahar, about Syria, about all of it. Briggs was quiet for a long moment. Then he said, because I was a coward. Because admitting I'd made mistakes meant admitting I'd gotten people killed, and I couldn't live with that. So you made other people live with it instead. Yes. Briggs met her eyes. I destroyed careers, ruined lives, all to protect myself, and I'm sorry. Rachel wanted to be angry, wanted to rage at him for the 8 months of guilt, the isolation, the damage he'd caused. But looking at him now, dying, broken, stripped of everything he'd built, she just felt empty. The Inspector General is opening an investigation, she said, into Syria. They're going to prove you ordered the premature withdrawal, that those men died because of your call. Briggs nodded. Good, they should. It won't bring them back. I know. Briggs's voice cracked. But maybe it'll stop someone else from making the same mistake. Rachel stood to leave. Rachel, Briggs said, whatever you choose, military or civilian, don't let my failures define you. You're better than I ever was. Be better than I ever was. Rachel looked back at him. I'm trying. She left the hospice and made her decision. By the time she got back to Victoria's temporary apartment, a new place, since the old one was still a crime scene, her phone was ringing. General Hawthorne. Rachel answered. This is Dawson. I need your answer. Rachel took a breath. I'm declining the commission. Silence on the line. You're sure? Hawthorne asked. I'm sure, but I have a counteroffer. I'm listening. You want a rapid response medical unit. I want to build a trauma training program at Mercy Point that teaches civilian doctors combat casualty care. Partner with the military, train personnel from both sides, create a pipeline of medics who can handle the worst situations, whether they're in a war zone or an ER. Hawthorne was quiet. Then, that's ambitious. That's necessary, because the next crisis doesn't care if you're military or civilian. It just needs someone who knows what they're doing. And you think you can build that? I know I can, but I need DoD support, funding, access to training facilities, instructors who've been there. Another pause. I'll make it happen. On one condition. What's that? You consult on our rapid response unit, not full-time, just enough to make sure we're doing it right. Rachel smiled. Deal. She ended the call. Looked at Victoria, who'd been listening from the doorway. You're staying, Victoria said. I'm staying, but we're doing this my way. I wouldn't have it any other way. The next morning, Rachel walked into Mercy Point Hospital as the new chief of trauma services. The staff was assembled in the main conference room, nurses, residents, attendings. Everyone who'd witnessed her fall and rise. Everyone who'd doubted her.
Rachel stood at the front of the room. No notes, no prepared speech, just the truth.
"Most of you know who I am by now," she said. "Shield 6, combat medic, the woman you spent 6 months trying to fire." A few uncomfortable shifts in the audience.
"I'm not here to make you feel guilty," Rachel continued. "I'm here to make you better. Because what happened to me, the discrimination, the dismissal, the failure to recognize talent when it was right in front of you, that can't happen again. Not here. Not anywhere."
She pulled up a presentation on the screen behind her. "This is the new trauma protocol. It's based on combat medicine principles. Aggressive intervention, rapid decision-making, zero tolerance for hesitation, and it's going to save lives." For the next hour, Rachel walked them through the changes, new training requirements, new equipment, new standards that would push everyone beyond what they thought possible. Some of the staff looked terrified, some looked excited, but all of them listened. When she finished, a resident in the back raised his hand. "What if we can't keep up?" Rachel looked at him. "Then you learn to, or you find another specialty. Because in trauma, keeping up isn't optional. It's survival." The meeting ended. Staff filed out, whispering among themselves. Victoria approached Rachel. That was intense. It needed to be. "Think they'll follow you?" Rachel looked out at the ER floor, at the patients being triaged, at the chaos that never really stopped. "They will. Because the alternative is watching people die who they could have saved. And once you've seen that, you can't unsee it." Over the next 3 weeks, Rachel transformed Mercy Point's trauma department. She fired 2 attendings who refused to adapt, promoted 3 nurses who showed promise, brought in military instructors to run drills, installed new equipment, rewrote protocols. The staff pushed back at first. Then they saw the results. Save rates improved, response times dropped, patient outcomes soared, and slowly, grudgingly, they started to trust her. A month after she'd started, Rachel was reviewing charts when Victoria appeared in her office doorway. "There's someone here to see you," she said. Rachel looked up. "Who?" "Corporal Hayes, from the Convoy." Rachel's breath caught. She stood, walked out to the ER lobby. Hayes was there, standing on his own, looking healthier than he had any right to be. When he saw Rachel, he smiled. "Ma'am," he said. Rachel crossed the room. "You're supposed to be recovering." "I am recovering. Doctors cleared me for light duty." Hayes held out his hand. "I wanted to thank you for saving my life." Rachel shook his hand. "You already thanked me." "I know, but I wanted to do it in person, and I wanted to tell you something." Hayes' expression turned serious. "The whole team, everyone from that convoy, we're putting together a fund for trauma training. We heard what you're building here, and we want to support it." Rachel's throat tightened. "You don't have to—" "Oh, yes we do. Because you didn't just save us. You showed us what medicine should look like when it's done right." Hayes smiled. "And we want other people to have that." Rachel didn't trust herself to speak, so she just nodded. Hayes saluted. Rachel returned it. Then he left. Victoria appeared at Rachel's side. "You're crying." Rachel wiped her eyes. "No, I'm not." "Yes, you are." Rachel almost laughed. "Okay, maybe a little." That night, Rachel sat in her new apartment, a better place, quieter, with actual furniture, and finally turned on the phone she'd been ignoring for 8 months. Dozens of messages, most from people she didn't know. But one caught her attention, a voicemail from 3 weeks ago, from Commander Ellis, her old CO. She played it. "Shield 6, it's Ellis. I heard about Syria, about the investigation. I just wanted you to know. I'm testifying about what really happened, about what Briggs made me write in those reports. I should have spoken up years ago, but I'm speaking up now. Thanks for having the courage I didn't have." The message ended. Rachel sat in the darkness, letting it all sink in. Briggs was dying, his legacy destroyed. Brennan was gone, his career over. Reeves was facing trial, but the truth was coming out. And Rachel was finally building something that mattered. Her phone buzzed. A text from General Hawthorne. First joint training session scheduled for next month. DOD is sending their best. Don't embarrass us. Rachel smiled. She typed back, "Wouldn't dream of it." She set the phone down, looked around her apartment, at the medals she'd finally unpacked and hung on the wall, at the photographs from Kandahar that she'd stopped hiding from, at the person she'd finally stopped pretending not to be. The next morning, she walked into Mercy Point for another shift. The staff greeted her with nods, with respect, with the kind of recognition she'd spent 8 months being denied. Rachel moved through the ER, checking patients, reviewing cases, making the calls that saved lives. And for the first time in a long time, she felt like she was exactly where she belonged. Then her pager went off. Mass casualty event. Bridge collapse. 20 victims inbound. Rachel's pulse quickened. She grabbed the phone, called the trauma team. "All hands. Trauma Bay 1 through 4. This is going to be bad. Move." The staff moved. Rachel positioned herself at the entrance, ready to triage, ready to coordinate, ready to do what she'd always done. Keep people alive when the world tried to kill them. The first ambulance arrived. Doors flew open. A paramedic jumped out, saw Rachel, and his face flooded with relief. "Thank God you're here," he said. Rachel stepped forward. "Talk to me." And as the chaos erupted around her, as the wounded flooded in, as every instinct she'd ever honed kicked into overdrive, Rachel realized she'd finally stopped running. She was home. But in the distance, barely audible over the sirens and shouting, her phone rang one more time. Unknown number. And when the voicemail came through hours later, after the crisis had passed and the patients were stable, Rachel listened to a message that made her blood run cold. A woman's voice. Calm. Professional. Terrifying. "Ms. Dawson, my name is Director Sarah Caldwell, CIA. We have a situation that requires your unique expertise. It's above your clearance level, but I'm authorized to read you in. Call me back at this number. We don't have much time." Rachel stared at the phone. She'd thought this chapter was closed, thought she'd finally found peace, but the world had other plans. And somewhere out there, another impossible situation was waiting for the only person who could handle it. Rachel Dawson, Shield 6, the woman who refused to let people die. Rachel deleted the voicemail without calling back. She'd made her choice, built something that mattered, and she wasn't going to let some shadowy agency pull her back into the darkness just because they had a crisis they couldn't handle. The world was full of crises. It didn't need her for all of them. She finished her shift, reviewed the bridge collapse cases with her team, and went home. Slept for 6 hours. Woke up to 17 missed calls from the same unknown number. The CIA didn't give up easily. Rachel blocked the number, made coffee, went back to work. 3 days later, Director Sarah Caldwell walked into Mercy Point Hospital and sat down in Rachel's office without being invited. "You're persistent," Rachel said, not looking up from her charts.
"You're necessary." Caldwell was 50s, sharp-suited, with eyes that had seen things most people couldn't imagine. "And you're making a mistake. By not jumping when you call? By thinking you can ignore this." Caldwell placed a folder on Rachel's desk. "Open it." Rachel didn't touch it. "I'm done with classified operations." "This isn't an operation, it's a reckoning." Something in Caldwell's voice made Rachel look up. The director's expression was grim, almost haunted. "What are you talking about?" Rachel asked. "James Briggs didn't just lie about Syria and Kandahar. He's been covering up mission failures for 15 years, manipulating reports, burying evidence, destroying careers of anyone who questioned him. And before he dies, he's planning to burn every document that could prove it." Rachel's blood went cold. "How do you know?" "Because he reached out to us. Said he'd cooperate with our investigation into his conduct if we guaranteed immunity for certain associates, people in positions of power who helped him bury the truth." Rachel stood slowly. "You're cutting deals with him. We're trying to get justice for the soldiers he failed. That requires leverage." Caldwell's jaw tightened. "But Briggs has cancer. He'll be dead in weeks. And when he dies, everything he knows dies with him unless we act fast." Rachel walked to the window, looked out at the ER parking lot where her entire life had changed. "What do you need from me?" she asked quietly. "Testimony. You were there for Kandahar. You reviewed the Syria documents. You know how he operates. If you testify before a closed congressional hearing, we can force his associates into the open before he dies. And if I don't,
Then dozens of soldiers who died because of his negligence never get justice. Their families never get answers, and the people who helped him get away with it continue their careers unchallenged. Rachel closed her eyes. She'd spent weeks building distance from this, creating a life where she wasn't defined by Briggs's failures. But the soldiers who died deserved more than her comfort. "When's the hearing?" she asked. 2 days. Washington. "We'll fly you out, bring you back same day." Rachel turned. "I want something in return." Caldwell raised an eyebrow. "You're negotiating?" "I want full disclosure. Every mission Briggs compromised, every report he falsified, every career he destroyed, all of it made public once the hearing concludes." "That could damage. I don't care what it damages." Rachel's voice was hard. "If we're doing this, we're doing it right. No more secrets, no more cover-ups. The truth comes out, or I walk." Caldwell studied her for a long moment. Then she nodded. "Agreed." Rachel grabbed her coat. "Let's go." The flight to Washington was quiet. Caldwell spent most of it on encrypted calls, coordinating with people Rachel would never meet. Rachel spent it reviewing the files Caldwell had given her: mission reports, casualty lists, communications logs spanning 15 years. The pattern was unmistakable. Every time a mission went sideways, Briggs had been there. And every time, the official reports had been sanitized to protect him while someone else took the fall. Medics like her, junior officers, enlisted personnel who couldn't fight back. The plane landed at Reagan National just after dawn. A car took them to a nondescript office building in Arlington. No signs, no identification. Just security that would make Fort Knox jealous. Inside, Rachel was led to a conference room where 5 senators sat waiting. 3 men, 2 women, all looking at her like she was either a savior or a problem they hadn't decided how to handle yet. Senator Patricia Voss spoke first, gray-haired, sharp-eyed, chair of the Armed Services Committee. "Ms. Dawson, thank you for coming." Rachel sat down. "Let's get this over with." Voss almost smiled. "Direct. I appreciate that." She opened a tablet. "We've reviewed your service record. Impressive doesn't begin to cover it, but we're here to discuss Colonel James Briggs and his conduct over multiple deployments." "What do you want to know?" "Everything." For the next 3 hours, Rachel walked them through it. Kandahar, the ambush, the 32 soldiers she'd saved and the 14 she'd lost. The way Briggs had written reports that made it sound like she'd hesitated when the truth was he'd ignored intelligence warnings and pushed them into a kill zone. Then Syria, the premature withdrawal, the 3 men left behind, the after-action reports that erased their final minutes. Then the others. Missions Rachel hadn't been part of, but had reviewed in Caldwell's files. A pattern of recklessness disguised as tactical necessity, failures reframed as successes, casualties dismissed as acceptable losses. The senators asked sharp questions. Rachel answered every one without hesitation. When she finished, Senator Voss leaned back. "This is damning." "This is the truth," Rachel said. "If we make this public, it'll destroy faith in military leadership." "Good." Rachel's voice was flat. "Because that faith was built on lies. And soldiers died because people were too afraid to challenge someone with stars on his collar." One of the other senators, a younger man named Torres, spoke up. "What about the people who helped him? The ones who signed off on these reports knowing they were false?" "Prosecute them," Rachel said. "Every single one." That could be dozens of officers, careers spanning decades. Then they shouldn't have helped him lie. The room went quiet. Voss exchanged glances with the other senators. Then she said, "We'll need you to testify publicly at a full committee hearing. Can you handle that?" Rachel thought about the media circus, the scrutiny, the inevitable attacks on her credibility. Then she thought about Hayes, about the soldiers in Syria, about every person who died while Briggs protected his reputation. "When?" she asked. "Next week. We'll schedule it for maximum impact." Rachel stood. "I'll be there." Caldwell walked her out of the building. "That took guts. That took honesty. There's a difference." They got back in the car, started the drive to the airport. Halfway there, Caldwell's phone rang. She answered, listened, and her face went pale. "Understood." She hung up, turned to Rachel. "Briggs is dead." Rachel's breath caught. "What?" "Heart failure, 20 minutes ago. He's gone." Rachel stared out the window. Processing. The man who'd defined so much of her pain, who'd carried secrets that could have brought down careers, gone before he could face any of it. What happens now? She asked. The investigation continues. His death doesn't erase what he did. Caldwell's voice was firm. And your testimony just became even more critical. You're the last credible witness to some of these events. Rachel nodded slowly. Then I'll make sure it counts. The public hearing was held 6 days later in a packed Senate chamber. Media filled the gallery. Military brass sat stone-faced in the front rows. And Rachel sat at a single table facing the committee, every camera in the room trained on her. Senator Voss called the session to order. We're here to examine allegations of misconduct and dereliction of duty spanning multiple military operations. Our witness is Rachel Dawson, former combat medic, decorated veteran, and current chief of trauma services at Mercy Point Hospital in Portland. Rachel was sworn in. Voss began the questioning. Ms. Dawson, you served under Colonel James Briggs in Afghanistan. Can you describe the events of the Kandahar operation? Rachel took a breath. Then she spoke. She described the ambush in clinical detail, the tactical failures that preceded it, the moment Briggs had ignored warnings and pushed the convoy through, the 14 casualties that resulted. She described Syria, the withdrawal order that came too early, the 3 men left behind. She described the pattern of falsified reports, buried evidence, destroyed careers. And she did it all without emotion, without embellishment, just cold facts delivered with the precision of someone who'd seen too much to lie about any of it. When she finished, the chamber was silent. Senator Torres leaned forward. Ms. Dawson, these are serious allegations against a deceased officer who can't defend himself. How can we verify what you're saying? Rachel pulled out a folder, handed copies to the committee. These are the original field reports from Kandahar, the ones written in real time before Briggs had them edited. They contradict his official version in 17 specific instances. I've highlighted them. Torres scanned the documents. His face went pale. Voss spoke up. How did you obtain these? Commander Ellis provided them. He's prepared to testify that Colonel Briggs ordered him to falsify the after-action reports. Ellis is testifying? Voss looked shocked. He is, along with 4 other officers who were pressured into covering up Briggs's failures. The hearing erupted. Senators conferring, media shouting questions, military brass looking like they'd been struck. Voss banged her gavel. Order, we'll recess for 30 minutes. Rachel stood, walked out of the chamber, found a quiet hallway, leaned against the wall. Victoria appeared beside her. She'd flown out for the hearing, insisted on being there. You okay? Victoria asked. Rachel nodded. I just ended the careers of people I used to respect. You told the truth. They're the ones who chose to lie. Doesn't make it easier. No, Victoria said quietly, but it makes it right. The hearing reconvened. For the next 2 hours, senators grilled Rachel on every detail, tried to find inconsistencies, challenged her memory, questioned her motives. Rachel never wavered. When it finally ended, Voss delivered a statement. Based on the testimony we've heard today, this committee will be launching a comprehensive investigation into military misconduct and accountability failures. We will pursue charges against any officer found to have participated in falsifying records or covering up command failures. And we will implement reforms to ensure this never happens again. She looked directly at Rachel. Ms. Dawson, on behalf of the United States Senate and the soldiers whose voices you've given back today, thank you. Rachel flew back to Portland that night, exhausted, hollowed out, but lighter somehow. The next morning, she walked into Mercy Point to find the entire trauma department assembled in the conference room. Victoria stood at the front. We watched the hearing, all of us. Rachel stopped in the doorway. You didn't have to... Yes, we did, Victoria gestured to the staff, because we needed to understand who you really are, what you've been through, and what it cost you to keep going. One of the residents stepped forward, a young woman named Dr. Sarah Mills who'd been skeptical of Rachel's methods. I owe you an apology. I thought you were too hard on us, too demanding, but watching you testify, seeing what you survived, her voice cracked. You're not hard on us because you're mean. You're hard on us because you know what happens when we're not good enough. Rachel's throat tightened. Another nurse spoke up.
You saved my life during the bridge collapse. I had a bleeder I couldn't find and you walked me through it without taking over. You made me better instead of making me feel small. Then another. You fired me 3 weeks ago. Best thing that ever happened to me. I wasn't cut out for trauma and you knew it before I did. Now I'm in pediatrics and I love it.
One by one, they shared stories. Moments Rachel had barely remembered. Lives she'd changed without realizing it. When they finished, Victoria said, "We took a vote, unanimous. We're renaming the department." Rachel frowned. "What?" "The Shield 6 Center for Trauma Excellence." Victoria smiled. "Because that's what you built. Excellence that doesn't quit, that doesn't compromise, that refuses to let people die." Rachel couldn't speak, couldn't breathe. The staff applauded. Not polite applause. Real, thunderous recognition. Rachel wiped her eyes. "I don't deserve—" "Yes, you do," Victoria said firmly. "Stop arguing and accept it." Rachel almost laughed. "Okay." 3 weeks later, the Inspector General's report was released. 17 officers were charged with falsifying records. 6 were court-martialed. Reforms were implemented across the military medical corps. And in a quiet ceremony at Arlington National Cemetery, the 3 soldiers who died in Syria were posthumously awarded medals for valor. Their families finally got the truth about how they died. Rachel attended, stood in the back, watched the families cry and hold each other. Afterward, one of the mothers approached her. "You're Shield 6. Rachel nodded. "My son wrote about you, said you were the toughest medic he'd ever met, that you never gave up on anyone." The woman's eyes were red but steady. "Thank you for not giving up on him, even after he was gone." Rachel's voice was barely a whisper. "I'm sorry I couldn't save him." "You saved his memory. You made sure people knew the truth." The woman gripped Rachel's hand. "That's everything." Rachel flew back to Portland, back to Mercy Point, back to the life she'd built from the wreckage of everything she'd lost. 6 months after the hearing, the trauma center was thriving. Save rates were the highest in the region. The training program had expanded to include partnerships with 3 other hospitals, and the first class of military-civilian integrated medics graduated with skills that would save lives in any environment. Rachel stood at the ceremony watching the graduates receive their certifications, saw the pride in their faces, the confidence, the readiness. Victoria appeared at her side. "You did this." "We did this," Rachel corrected. "No, you started it. I just helped." Victoria smiled. "And now you've got a visitor." Rachel turned. General Hawthorne stood near the door, looking uncomfortable in civilian clothes. Rachel walked over. "General?"
Ms. Dawson, or should I say Chief Dawson. Hawthorne almost smiled. "I hear your program is making waves. We're doing good work. Better than good, which is why I'm here." Hawthorne pulled out a folder. "The Rapid Response Unit I mentioned, it's operational now, and we've modeled the entire medical protocol on your training standards." Rachel took the folder, scanned the contents, saw her methods, her protocols, her philosophy reflected in every page. "We're calling it the SHIELD Initiative," Hawthorne said, "in honor of the medic who showed us what was possible when you refused to accept failure." Rachel looked up. "I'm not active duty. Why name it after me?" "Because you earned it, and because the next generation of combat medics deserves to know whose shoulders they're standing on." Rachel didn't know what to say. Hawthorne held out her hand. "Thank you for not giving up. On yourself or on us?" Rachel shook it. "Someone told me once that I'm the person who runs toward the crisis. Took me a while to accept that's not a flaw." "It's not." Hawthorne's grip was firm. "It's a calling." That night, Rachel sat in her office long after everyone else had gone home, looked at the certificates on her wall, the photographs, the evidence of a life rebuilt from nothing. Her phone buzzed, a text from Hayes, who was back on active duty and thriving. "Just finished the SHIELD Initiative training, hardest 3 months of my life. Worth every second. Thank you for showing us the standard." Rachel smiled, typed back, "Don't thank me. Just save lives." She set the phone down, stood, walked out to the ER floor, a few patients in beds, night shift nurses checking vitals, the quiet hum of a hospital between crises. Rachel moved through it like a ghost, checking on things that didn't need checking, adjusting things that were already perfect,
just being there because this was where she belonged. A young resident approached her. "Chief, sorry to bother you, but we've got an incoming trauma. MVA, 3 victims, 1 critical." Rachel's pulse quickened. Old habits. "I'll take the critical case. Get Trauma Bay 1 ready." "Yes, ma'am." The resident ran off. Rachel grabbed a trauma gown, tied it on, and positioned herself at the ambulance entrance. The doors burst open. Paramedics wheeled in a gurney. A woman, mid-20s, unconscious, chest crushed from steering wheel impact. Rachel moved into position, hands already assessing, mind already 3 steps ahead. "Talk to me," she said. "Unrestrained driver, T-boned at 40 miles per hour. Lost vitals twice in transport. We got her back, but she's unstable." Rachel checked the monitor. Blood pressure crashing, heart rate erratic. "Get me a central line kit and call the OR. She's got internal bleeding. We're going up in 5 minutes." The team moved. Rachel worked, hand steady, voice calm, every action precise. The woman's pressure stabilized, her rhythm evened out. Rachel stepped back. "Get her upstairs, now." They moved the patient. Rachel stripped off her gloves, took a breath. The resident who'd called her appeared. "That was incredible." Rachel shook her head. "That was training. You'll be doing it yourself in a year." "I hope so." "You will." Rachel looked at her. "As long as you remember one thing." "What's that?" "People are counting on you to be better than you think you can be. Don't let them down." The resident nodded seriously. "I won't." Rachel watched her walk away, saw herself in that determination, in that hunger to be worthy of the trust placed in her. She'd spent so long thinking she was broken, damaged, not enough, but standing here, in the hospital that had tried to destroy her and that she'd transformed into something better, she finally understood. She wasn't broken. She'd been forged. Every failure, every loss, every moment of pain had shaped her into someone who didn't quit when things got hard, who ran toward the crisis instead of away from it, who refused to let people die because it was easier than fighting. That wasn't weakness. It was power. And she'd finally learned how to use it. 3 years later, Rachel stood on a stage in front of 2,000 medical professionals at a national trauma conference. The keynote speaker, the authority, the person everyone wanted to learn from. She looked out at the audience, saw doctors, nurses, paramedics, people who saved lives every day, people who needed to be reminded why it mattered. "I used to think strength meant not showing weakness," she began. "That being tough meant never admitting when things hurt. But I was wrong." The audience leaned forward. "Real strength is showing up even when you're terrified. It's admitting you failed and learning from it instead of hiding. It's being vulnerable enough to ask for help and humble enough to accept it." Rachel paused. "And it's refusing to let anyone tell you you're not good enough when you know you are." She told them about Mercy Point, about being dismissed, sidelined, nearly fired, about the moment everything changed and she stopped hiding from who she was. "They called me broken," she said. "Too slow, too damaged, not cut out for trauma, and I spent months believing them because it was easier than fighting back. But here's what I learned. The people who tell you you're not enough are usually the ones who are threatened by what you could become. And the moment you stop listening to them and start believing in yourself, that's when everything changes." The audience was silent, captivated. "So if you're struggling right now," Rachel continued, "if you feel like you're not measuring up or that you don't belong, remember this. You are exactly where you need to be. The challenges you're facing are preparing you for something bigger. And the people trying to tear you down are just proving how powerful you really are." She looked out at the faces staring back at her, saw recognition, understanding, hope. "Don't quit," she said. "Don't hide. Don't let anyone make you smaller than you are, because the world needs people who refuse to give up, who run toward the crisis, who save lives nobody else can save." She paused. Let the words land. Be that person, even when it's hard, especially when it's hard, because that's when it matters most. The applause started slowly, then built, then became a standing ovation that lasted 5 minutes. Rachel stood at the podium, looking out at 2,000 people who finally saw what she'd fought so hard to show. Not the limp, not the scars, not the failure, the strength, the courage, the refusal to quit. And for the first time in her life, Rachel Dawson, Shield 6, smiled and accepted it. because she'd finally learned the truth that had taken years to understand. She wasn't the broken one. She was the one who refused to let broken things stay broken, and that made all the difference.